check. Hello, check. Hello, check. 1, 2, 1, check. Hello.
हेलो 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 हाँ આવે છે અવાજ બરોબર છે તારું हेलो हाँ થઈ ગયા
कर रहे हैं सर। सही बात है। Good morning, everyone. We welcome you on the second day of the Health Diplomacy Dialogue. I, Dr. Medha Vadva,
And I am Wing Commander Dr. Smita Rani, Consultant and Medical Supervisor at IIPHG. This is the day 2 of our 2-day dialogue on navigating health system challenges, India's health diplomacy in the Global South, organized under the auspices of the Tract 1.5 Health Diplomacy, supported by Policy Planning and Research Division, Ministry of External Affairs, Government of India. It is my pleasure to introduce our first panel discussion for today on utilizing the role of digital public infrastructure in international relations. It is an increasingly interconnected world. Digital public infrastructure is playing a transformative role in shaping global cooperation and diplomacy. Today, our expert panelists will explore how digital solutions can enhance international relations, streamline cross-border collaborations, and promote transparency and inclusivity. They will also discuss the potential for digital infrastructure to address global challenges in areas such as health, education, and governance. I look forward to a dynamic exchange of ideas and perspectives during this session, and I am confident that the insights that will be shared will be invaluable as we continue to navigate the digital age in international relations. I would like to welcome our chairpersons for this session, Shri Dhananjay Dwivedi and Dr. Deepak Saxena. A brief introduction. Shri Dhananjay Dwivedi is the Principal Secretary to the Government of Gujarat, Department of Health and Family Welfare. Shri Dwivedi is an IAS officer from the 1998 batch and currently serves as the Principal Secretary of the Health and Family Welfare Department in Gujarat. In his capacity, he oversees critical health initiatives and policies of the state. Additionally, he is a member of the Board of Directors of the Gujarat Medical Services Corporation Limited, contributing to the procurement and management of medical supplies and services. Previously, he has held significant roles, including Principal Secretary of the Narmada Water Supply and the Kalspa Department, the Secretary of the Government in the IT, Science and Technology Department. His diverse portfolio underscores his extensive expertise in governance and public administration.
we welcome you, sir. Our second chair, Professor Deepak B. Saxena, Director of Indian Institute of Public Health, Gandhinagar, is a distinguished public health educator and researcher. Previously a professor at IIPHG and faculty at Government Medical College, Surat, he has received prestigious awards like the Australian Leadership Award Fellowship and T5 Fellowship from Boston University, alongside national and international patents. At IIPHG, he leads initiatives like the Nidhi Techno Business Incubation Center, fostering healthcare innovation, and the Center of One Health Research. We welcome you, sir.
Please welcome a discussant for this session, Dr. Reshmi, who is Associate Dean and Professor and Head of the Department of Health and Information Management at MAHE. Dr. Reshmi is an academician and a researcher with a distinguished career in health information management, health policy, and public health research. She leads academic affairs, student activities, and branding at Manipal College of Health Professions, while also heading the Health Information Management Department at the Manipal Academy of Higher Education. Her research, supported by ICMR, WHO, and DFID, focuses on health systems in resource-constrained settings, digital health innovations, and culturally tailored health interventions. An internal auditor for quality assurance and a collaborator with the Global Burden of Disease Project, Dr. Reshmi plays a pivotal role in enhancing public health and education in India.
I would like to extend my warm welcome to our esteemed panelists for this session. Mr. Rohit Ritish, Joint Secretary, Development Partnership Administration Division 3 and Rapid Response Cell, Ministry of External Affairs, Government of India, has joined us virtually. Mr. Rohit Ratish is a seasoned diplomat with 18 years of experience in the Indian Foreign Service. He holds a B.Tech degree in Electrical and Electronics Engineering from Kozhikode, Kerala. Mr. Ratish has served in Indian missions in Geneva, Port Louis, Kabul, San Francisco, and Male, gaining extensive diplomatic expertise. At the Ministry of External Affairs, Mr. Ratish has held key roles including Deputy Chief of Protocol, Ceremonial, and Joint Secretary G20 Summit. Currently, he heads the Developmental Partnership Administration Division 3 and Rapid Response Cell since October 2023. Fluent in English, Hindi, Malayalam, Tamil, and French, Mr. Ratish is committed to fostering international partnerships and developmental cooperation. We welcome you, sir.
Our next panelist is Professor Gulshan Sachdeva. Professor Sachdeva serves as the Chief Coordinator of Dakshin Global South Center of Excellence at RIS, New Delhi, and is a professor at the School of International Studies at the Jawaharlal Nehru University. He is awarded the Jean Monnet Chair by the European Commission and has coordinated the Jean Monnet Center of Excellence at JNU. He has consulted for organizations like ADB, Asia Foundation, and ILO, and served as the ICCR Chair at the University of Leuven. Professor Sachdeva holds a PhD in economics from the Hungarian Academy of Sciences, Budapest. Welcome, sir.
Shri Raghu Dharmraju, who has also joined us virtually, has over 2 decades of experience in building and scaling impactful innovations and institutions. He is a fellow of the Lancet Commission for Reimagining Health's System in India. At Art Park, he fosters AI and robotics innovations for societal good in LMICs, focusing on digital public infrastructure and equitable AI, recognized globally for initiatives in health, climate, and languages. Previously, as a founding leader of Vadhvani AI, he built award-winning AI solutions for India's national TB elimination program and pandemic response. He has also scaled medtech startups like Embrace Infant Warmers to impact over 3 lakh babies in 20 countries. Mr. Raghu holds degrees from IIT Madras, UMass Amherst, and Cornell with a history of mentoring health tech startups through global innovation programs. We welcome you, sir.
Our next panelist is Shri Bhruguraj Praveen Chandra Trivedi, who serves as the Joint Director IT and the SPOC for the Ayushman Bharat Digital Mission at the National Health Mission Gujarat. With a BE in Information Technology and an MBA in IT and certification as a project management professional from PMI USA, he brings extensive expertise in e-governance, project management, data analysis, and dashboard development.
Dr. Abha Mendiratta is a healthcare expert and faculty at the Institute for Healthcare Improvement, mentoring quality improvement teams across Southeast Asia. As a non-resident fellow at the Center for Global Development, she advocates for evidence-based medicine and the use of economic evidence in decision-making. She has collaborated with India's Ministry of Health and global organizations like World Bank and NICE UK to advance universal health coverage goals. A Fulbright scholar with a master's in public health from Harvard, Dr. Mendiratta also advises the AIMS Humanities in Medicine initiative.
Our next panelist is Shri Satish Ranjan Sinha, who's a Joint Secretary cum OSD, General Administration Department, Government of Bihar. Shri Sinha is an experienced officer with an extensive expertise in rural development, skill, e-governance, digital health initiatives, social protection, and sustainable development. Currently, he's serving as the Joint Secretary cum OSD in the General Administrative Department of Bihar. He also holds additional responsibilities in the Health Department. With a strong background in public policy, strategy planning, and policy analysis, Dr. Sinha has collaborated with international organizations such as UNDP, supporting the Government of India, Ministry of Rural Development. His comprehensive knowledge and dedication to social services have made him a significant contributor to various development programs.
Shri Suhail Bidani leads the digital and supply chain platforms at the Bill and Melinda Gates Foundation's India office, focusing on digital interventions and supply chain improvements across programmatic work. With over 17 years of professional experience, Mr. Suhail has worked across 25 plus countries, specializing in ICT 4D and national level e-government initiatives in Asia and Africa. Before joining the foundation, he held senior roles at PwC India and Wipro Consulting Services. Mr. Suhail holds a bachelor's degree in commerce and an MBA in strategy and systems. A passionate advocate for social development, he is committed to the vision that all lives have equal value, leveraging his extensive expertise in business and technology advisory to create impactful solutions in developing countries. He has also joined us virtually.
Last but not the least, our next panelist is His Excellency Mr. Kamal Zayed Kamal Galal, Ambassador, Arab Republic of Egypt. A seasoned diplomat with extensive experience in Egyptian Foreign Service, he is currently serving as the Ambassador Extraordinaire and Plenipotentiary of the Arab Republic of Egypt to India since February of 2024. His previous roles include Minister, Plenipotentiary, and Deputy Assistant Minister for Levant countries, Political Advisor for the Gaza Crisis Management Committee, and Deputy Chief of Missions to the Egyptian Embassy in Tel Aviv. He has held key positions at the Ministry of Foreign Affairs, including Director of Syria and Lebanon Affairs, Iraq and Jordan Affairs, and Non-Governmental Organization Affairs. He has also served in various diplomatic capacities at Doha, Brussels, Cameroon, and the cabinet of the Egyptian Prime Minister. I would now like to hand over the stage to the chairperson for his address.
Distinguished panelists on the dais, representatives of different embassies, consulates, and participants. A warm good morning to all of you. It's indeed my privilege to be here sharing my thoughts on leveraging digital public infrastructure for diplomacy. Before we get into that subject, let me talk about why is this relevant when looked at it from the health as a sectoral perspective. What has the infrastructure of health to do with global diplomacy? I would want you to take you back some 4 years ago, have a reflection about what we had as part of COVID pandemic, when for the first time all the nations were racing against time to have access to right vaccines to save their people from the uncertainties, the risks that the COVID was offering. And in that context, we, India, as a country, sent almost 240 million vaccine doses all over the world to save people from those uncertainties. For a moment, let us take out the word digital, reflect on it, that what public health infrastructure can do to contribute to our well-being, to our life, not just within the state, not just within the country, but as a resource across the world. And when seen in that context, I must compliment the Ministry of External Affairs as well as IIPH to have zeroed in on this topic and put this as an opportunity or as a question or as a thought for leveraging what the public health infrastructure of a state or of a country can do for rest of the world. And in that context, I am happy and feel privileged to be with you, having this opportunity of sharing my thoughts. What would digital health infrastructure do for us, for the world, for the humanity? Getting into digital domain, there are two contrasting value propositions. On one hand, you have the aspect of individual privacy, data protection. On the other hand, you have wealth of anonymized digital data bank that can allow everyone to develop, to fine-tune, to calibrate their processes, their products, their innovations, and the tons of opportunities that can flow out of that. Once we start looking at the data bank as a resource that can lead to value creation, then we realize how the nations can leverage that value to build better partnerships, to work out collaborations, to create models that can work not only in one geography, but across different geographies, and create opportunities and value for all of us transcending the borders. As I said, during COVID times, India produced more than 2.5 billion vaccines. Almost 1.2 billion people in India, they were vaccinated with 2 doses. But in addition to that, 1/3 billions across the world, they were also vaccinated with the vaccines, with the technology, with the product that was developed, manufactured within India. That is the kind of strength the public institutions in India have got that can be leveraged for the global good. Now allow me to talk about public institutions. Being in government, and normally in our discussions, when we talk about public, we try to make a distinction from the private capabilities, be it private enterprise, the corporates. So we limit ourselves by mentioning public infrastructure or public systems to those which are owned or controlled by the public sector. But as I say about my own role, when I'm health secretary in Gujarat, I'm not health secretary of public institutions. I'm health secretary for public, private, the entire health ecosystem of Gujarat. Likewise, when we mention about public infrastructure, that infrastructure has resources and capabilities which come from both the government institutions as well as private institutions. My friends from the panel, they'll be delving deeper into different dimensions of digital public infrastructure, but I'm happy to share that Government of India has launched ABDM project, the ABA project, and of 70 million people from Gujarat, 45 million people from Gujarat are already digitally enrolled with their consent to share anonymized health records for greater public good. This is a subset of what one state is doing as part of the nation's initiative. Now imagine millions of health records tagged with millions of permutation and combinations of health conditions, symptoms, tagged with maybe tens of thousands of different devices which are either being used for diagnostics or for testing or for calibration. And what this data mine can offer to the entrepreneurs, to the innovators, to the developers, to the global health systems. That is the potential that the digital health infrastructure of this country is going to have. And we as a state are very happy to contribute to building that infrastructure proactively to make sure that the advantages are available to everybody for the development of humanity. I sincerely thank IAPS team as well as MEA for so thoughtfully curating this particular topic, putting it in public domain, and once again to IIPH for giving me this opportunity of sharing my thoughts on this digital public infrastructure and its potential for diplomatic relations to you. Thank you very much.
Thank you, sir. I'd now like to invite our other chair, Dr. Deepak Saxena, for his opening remarks. Okay. I would now request our discussant, Dr. Reshmi, to kindly facilitate the entire panel discussion. Thank you.
A very good morning, esteemed chairpersons and the esteemed panelists. I would now like to take this opportunity to put forward the panel discussion questions. First to Shri Rohit Ratish. Sir, am I audible?
Yes, you are.
Okay, thank you, sir. So, my question to you is, what is the potential of digital public infrastructure for having improved health and international relations?
Thanks. I wish to thank the chair, Ranjit Dwivedi, sir.
Thank you, sir, for highlighting about the digital public infrastructure, and especially the Global South, and also regarding Dakshin, which I'll be taking up the next question with Professor Gulshan. Sir, the question to you is, again continuing with the thread, how Dakshin, the Global South Center for Excellence, is involved in the areas of digital public infrastructure and health within the countries of Global South.
Thank you. Thank you, Dr. Rashmi. And, the stage has been set both by the chair and by Joint Secretary Rohit Ratesh. I mean, for me, it's very easy now to enter here. Since yesterday we have been talking about Global South, but as in fact, Joint Secretary was mentioning, Global South today is not the Global South of the past. It's not a bunch of few countries, developing countries, struggling with certain problems, which of course problems are there. Today, if you look at any number, you look at the number of not just population, but look at the numbers of trade, you look at the numbers of investment inflows, you look at any kind of economic indicators, Global South is playing very, very important role in the global economy. Within Global South, you have heavyweights, economically, strategically, politically. So they obviously have their own ambitions, they play their own, their own role within the global economy and the global governance structures. But it's not just only about, I'm talking about big global South countries. I mean, yesterday we heard from the High Commissioner from Seychelles. You have success stories everywhere, in smaller global South countries, in big global South countries, and what all global South countries are trying to do to assert their voice. Because what is happening today, if you look at all the institutions of global governance, not just only within the UNSC and other UN agencies, but also you look at WTO, you look at WHO, they have become very ineffective. So where Global South can really play its role, of course, within G20, we do have some big countries, but as in fact, Mr. Rohit was mentioning, when G20 happened, it's not just only we were talking to only countries within G20, we had the voice of the Global South Summits, 1, 2, 3. And in fact, Dakshin is a product of all those conversations we had in the very first meeting itself, where Prime Minister, after talking to all the leaders, more than 120, 25 leaders, he announced that India is going to set up Global South Center of Excellence. And then during the second, Global South Summit meeting, this Dakshin Global South Center of Excellence was set up, and then he himself inaugurated it. So the problems of the Global South, the way we are trying to, it's not that the Global South has become important and the problems of the Global South have disappeared. No, because there are problems. At the same time, all the things which are happening at the global level, you look at the whole, the green transition, you look at all the new technologies from artificial intelligence to anybody else. It's not that the global north is going to give up their leadership in many of those areas. So the globals, but there are also success stories, there are also, potential, there are also things which are happening within Global South. So what at Dakshin we are trying to do is, in fact, in the last 1 year since its existence, we have talked to large number of think tanks within the Global South. We have already signed agreements with more than 135 or association agreements with around 85 countries, and with many more the conversations are on. So what we are really doing in the first 1 year, it was done, particularly because, during when our Dakshin Global South Center Excellence was set up, many areas were identified, but to begin with, in fact, the areas, particularly what we are discussing here, the IT sector, the digital, solutions, and the health and agriculture. These were the three areas in which we initially really kind of focused on. And you are really, I mean, you could see that the kind of response from other global south countries, and they were also looking at, and you know, what we were trying to explain to them in our first conversations that, you know, this is what the Dakshin is, this is what India's flagship programs are. So all the things what we have been doing within the IT sector, you know, we said in the last 10 years, 15 years, these are the kind of major programs we have initiated. We have built certain capacities, and we feel that some of these programs are successful, which can be perhaps implemented in other countries. Similar thing is happening also in the health sector. And then we are also, in fact, you know, more interested in also knowing what exactly is happening in your countries. What is happening in Africa? What is happening in your small countries, big countries? Because every country is doing different kind of experiments, and many of them are very, very successful. So what we are trying to do at Dakshin is trying to collate all this knowledge, not just only from India, but also from other global south countries, and particularly in these two areas, the last, you know, from Egypt, I mean, I'm sure there'll be many success stories, similarly, you know, from other countries where all the representatives are here. So what we are trying to do is collect all that information first, that what are the things which are happening in all global south countries, and then what really we can work. I mean, then after, just because, you know, since we are dealing with all those think tanks, so you have first, I mean, they are very easy to have a policy dialogue, conversations of those nature. And then also on the capacity building, technology transfer. And then once we get certain kind of proposals on whether in the IT sector, in the digital solution, DPI, or in the health sector, or in agriculture, then we really look around. Who can really implement within India, outside India? Of course, since, you know, the first, our point is looking with our own ministries, looking our own agencies, and also our own private sector, our own other, you know, so many people are working in different ways. And then also looking at a multilateral organization, where do you really fit this whole thing? And it's not just only Indian solutions. Solutions can come from anywhere else for the global south. This is what exactly we are trying to do at Dakshin, particularly in the health and the digital public infrastructure in the last 1 year or so. Thank you.
Thank you, sir, for highlighting the Global South corporations and, you know, what which each country can learn from each other. Moving on to Mr. Raghuram Dharmaraju.
Hear me?
Yeah, sir, can you hear us?
Yes, I can hear you. I'm not keeping well, so is it okay for me to stay off camera?
Okay, sir, yes.
Yeah.
We can, I think we can continue the discussion, sir. So,
Yeah.
where Professor Sachdeva had left it, I mean, he had been discussing about Dakshin and the Global South. So we move on to digital health literacy. So what role does digital health literacy play in creating an enabling environment for the digital public infrastructure, and how can the regulations support this? So if you can highlight on this particular question.
Yeah, I actually want to start on digital health literacy. I'm going to modify that a little bit to generally talking about literacy about what digital public infrastructure itself is. I think that I see as an important element in actually enabling effective and useful regulation. What do I mean by that? And I'm going to use our own work as an example so that I'm not too abstract. We build AI-based solutions for various areas, including health. Public health is a priority area for us. Now, when we say AI-based solutions, that's a bit like saying we really want cars. Right? And the challenge is, as a community of professionals, as regulators, as officials, we haven't yet really come to a certain common language around, okay, we want cars, but what we really need is a language for the parts that go into the car, the standards AI is built off of data. So I often say that we are first missing a common language and the systems, digital public infrastructure for the supply chains, right? The part names, the part standards, so on and so forth. So this is what you might refer to as the digital public infrastructure. But to house the digital public infrastructure, you need the institutional infrastructure, right? And that's extremely necessary because you don't just because I built a software today does not mean it changes the world. Ultimately, change happens in the physical world, change happens in moving atoms, change happens in moving people, physically as well as metaphorically, I guess. Okay. So that is one type of digital public infrastructure we need. The digital public infrastructure institutions to build AI-based solutions. Towards that, understand what do we mean for the car to come together, what kind of parts and systems we, right, the supply chains, so to say. On the other side, we also need infrastructure to run the cars. This could be the fueling, this could be ongoing maintenance, this could be the roads themselves. Right? Now what are the analogous systems for AI-based solutions? If you are going to deploy AI-based solutions, do we have the ability to monitor them continuously? Do we have the ability to periodically update them? These are, and institutionally, do we have the people capacity to actually use, manage, and monitor these systems? So again, here both there is institutional capacity as well as digital public infrastructure that would come into the picture. And I see the literacy around these areas, the nuances of this are often very lost. If we kind of pull it all together and talk it at very high. Couple of specific opportunity areas that I would say for India to especially lead the global south. One is distributed frameworks for evaluating AI-based solutions. That is one, for example. And why do I say distributed framework as opposed to centralized frameworks? India is a huge country, right? I've heard, experts and colleagues such as Anurag Agarwal say, Delhi lungs are different from Kerala lungs. And do we really want the exact same algorithm to be used in Delhi as well as in Kerala? I don't have the answer. But just like we might say that the algorithms that work in the US might not work in India, we want it locally validated. Seems to me if you stretch that argument, you might end up, and the other end of that argument is what you call individual precision medicine. Let's not go that far. But let's ask the question, what does it mean to build a framework, institutional mechanisms, digital public infrastructure, to allow, if not building from scratch, at least retraining and modifying AI algorithms for local use and also to monitor them. And if we build this for India, to me, it seems to me that's something that eminently, adaptable for the global south in general, and I would argue even for the global north. So with that, let me stop my comments. I'm happy to take any questions later. Hopefully this gives a sense of, and this is where I feel that there's an urgent need for digital health education, right at the topmost levels and decision makers levels, so that we can get to some nuances of this and build useful institutions and DPI, of course, that support them.
Thank you, Mr. Raghuram, for having highlighted the basically the digital health literacy at the highest level for this enabling environment. And it was also in line with what Professor Sachdeva had mentioned about what the other countries need and what we should take it from them, as well as so one size fits in all probably cannot work. Moving on to Shri Bhrigraj Trivedi. Okay, sir. Bhrigraj Trivedi, sir. I would put this question to you. How has India leveraged its digital public infrastructure successes like Aadhaar, UPI and ABDM, and probably what lessons the global community can learn from India's approach to scalability and inclusivity?
Thank you, Dr. Ashmi. I'm very thankful to the earlier speakers. The tone is set for the digital health and how it can be used for the digital public health and the digital public infrastructure. Let me give you some context about the Ayushman Bharat Digital Mission, ABDM. It is basically developing the backbone necessary to support the digital health infrastructure of the country, universal health coverage where the citizen is at the center of activities. The current strong digital public health infrastructure, including that related to Aadhaar, UPI, and wide reach of internet and penetration of mobile, it helps in achieving the building blocks of Ayushman Bharat Digital Mission, which are the Ayushman Bharat Health Account, ABHA, Health Facility Registry, HFR, and Healthcare Professional Registries. So these all registries and ABHA generation, these all are based, the mechanism is based on the strong and mature DPIs available. I will just give you some example. Say for example, we are using the Aadhaar utility to create ABHA. You just need to visit the page of ABHA, key in your Aadhaar number. It will send you an OTP to authenticate yourself. Key in the OTP received on your registered mobile number and your ABHA is created. It is as simple as that. It takes 30 seconds to create ABHA. Anybody sitting in this discussion, they can just check it, post this. It's very simple. We are using the services of Aadhaar for identification, authentication. Similarly, under the Ayushman Bharat umbrella, the initiative launched by Honorable Prime Minister, sir, for senior citizens aging beyond 70 years, they can apply, or they can rather generate their Ayushman card from their home itself. They just need to key in their Aadhaar number. They need to authenticate themselves with the help of OTP, and Ayushman card is generated. The best part of this initiative, be it the ABDM or the Ayushman card, it is inclusive for all. For ABHA, it is for everyone, irrespective of age, irrespective of gender. Anybody can create ABHA. Similarly, when we talk about the UPI, we can see the scalability and applicability. It is implemented at other countries as well. So what we can actually use it, or how it can be used at other locations. The best part is, this government is playing as a nodal agency where the legal framework is created, creating the ecosystem only. Rest, open APIs are there, open standards are there. So government institutes as well as private institutes, they are encouraged to get on board. And I'm very glad to share with you, more than 35 integrators applications from private participation is there in Ayushman Bharat Digital Mission for PHR applications, for HMIs, and private doctors, PPP organizations, they are very motivated to join with the ABDM platform. Another thing is, it is supported by government. Say for example, DPDP Act, Data Protection and Data Privacy Act. So it is not just that we are encouraging private practitioners, private parties to onboard, but at the same time, it is duly supported with the acts and rules and regulations. It is very easy to use, it is very easy to implement, and it is very interactive. So we do encourage different organizations, institutes to participate with this initiative, regularly interacting with them, and we can adopt the local conditions or the local requirements, and based on that it may be implemented. And of course, as discussed, we can schedule the capacity building sessions at local requirement, and it may be implemented. Thank you.
Thank you, Shri Trivedi. So you have mentioned about scalability and inclusivity and then moving down to the local level. So now, Dr. Abha, my question to you is how India has leveraged digital public health infrastructure in rural India and underserved areas, like he has also mentioned about being accessible to rural areas, and the ASHA program, probably how that can be a model to other nations. If you could highlight on this.
Thank you, Dr. Reshmi. So I think the ASHA program brings forth a problem which is common to the global south. Community healthcare workers are an integral part of a healthcare system, whether we look at countries in Africa, in Asia. Often they are volunteers, they're not part of the formal sector. They're incredibly important for crossing the social and geographic barriers in making sure people are able to access care to the last mile. But these workers face a lot of problem in getting fair remuneration because they're not part of the formal roles. And India also had similar problems where initially the payments that were made for these workers used to be in cash, which creates a lot of issues around transparency, leakages, dissatisfaction, loss of motivation amongst the workers. And the journey of digitization of the work that the ASHA does has really transformed over the last decade, starting with this first most important issue: how can we digitize the payments that she receives so that she can be fairly compensated? So the ASHA is an accredited social health activist in India who gets financial incentives for specific services that she provides. Initially they were focused on maternal and child health, but it has later expanded to the NCD program to tuberculosis. And the digitization, and I was in conversation with Sir, who's from Bihar. Bihar state was actually the first in collaboration with World Bank more than a decade ago to digitize using the public financial management system. And that part enabled that she gets her payments on time, she gets it directly in her bank, she gets more empowered, she can actually take loans, and we recently did a study in Maharashtra and Assam which validated these things that we said. Over the years, there have been further incremental improvements in how digitization is helping with the ASHA program. So moving one step further on how the claims are submitted, that also then got digitized, with some of the states coming with softwares, which allows her to submit the claim, or there is a person who's a data entry operator, so there was a bit of a manual effort, who then enters the forms and which gets digitized. But the big advantage is that it allows for monitoring. You can really monitor down to an individual ASHA level whose ID is linked to our Aadhaar to really see that, you know, what the performance is, where the gaps are within a state, which areas are performing well or not. And recently, in the state of Rajasthan, and again, Shri Sinha was saying even in the state of Bihar, and I'm sure other states would also be now thinking about it, the first step, which I think sometimes becomes the rate limiting step, where the actual, at the time of service delivery, giving her an opportunity to actually enter the data then and there. So there is a mobile app that's come out, which allows her to enter, which is linked with the pregnancy and child tracking system. So unique IDs of individual mothers and children who are getting provision of care allows for that data to be entered at the point of care, which then makes it very easy because her work is based on incentives which are linked to the service delivery, which makes it very easy for her to get fair payments, incentivizes her to work more, creates efficiency, creates transparency, and I think it's a win-win for the community, for the ASHA workers, and of course for the system, which ultimately wants to improve care. So a very powerful example of how digitization over the last decade has really transformed care, and I'm sure there would be other examples. I know there's been a lot of mobile solutions used in a lot of other countries in Africa and other countries in the global south, and there's an opportunity to learn what has worked there and have a bilateral exchange around that. So handing it back to you, Dr. Reshmi.
Thank you, Abha, Dr. Abha. Sir Satish sir, since she's already mentioned about the example of Bihar, we'll take it from there, sir. So the government of Bihar had an implementation of the Mukhyamantri Digital Health Yojana, and how these challenges were addressed, if you could highlight on that.
Thank you. Good morning, everyone. Greetings from the land of Buddha and Mahavir. I thank my panelists for giving very insightful perspective on the way DPIs can transform these sectors, the health sector, and the international collaborations that can happen in that area. Bihar is a state which in the map is practically in the heart area, but actually in many parameters it was deep south as far as health and other sectors was concerned. So how we leverage these UPIs to build our own digital platform and how we have gained with it, I'm trying to share that so that you can have a perspective of, from this experience you can think of how DPIs and the tools that the government of India has provided has been utilized in our case. The National Health Policy Framework, basically, it laid the foundation for digital transformation in India. And we saw the opportunity there as a state that though we are quite down in many areas, this gives us an opportunity to leapfrog, as our additional chief secretary used to tell us, to come quickly at par with other players, other states in the area, and make better, create better facilities for our citizens. So what we realized that our health management system was pretty, it was practically outdated. That was a problem there. Then there was, we had several web portals of Government of India, of state governments, and apps which were not talking to each other. The data was completely in disarray. And even as ma'am was talking about the ASHA workers, though we had put in place payment systems for them, but still their work was completely on paper, which had its own challenges. So keeping these things in mind and many more things that we were facing on the ground, in 2022 April, we came up with a Mukhyamantri Digital Health Yojana, basically a scheme for digital platform, of health digital platform. What we did was, as our earlier panelists were talking about, we aligned our HIMS with completely with the National Health Digital Mission, the ABDM. And it is completely compliant to that. We have built a lighter version of it. The HMIS that I'm talking about is for the health facilities, the district hospitals, and up to the community health centers. But below that, we have a lighter version also to cater to their needs. Apart from that, we build a mobile application, as ma'am was talking about, for the ASHA workers, so that these workers can actually get their task on the mobile, complete the task on the mobile, and their activities are booked on the mobile so that their claims are filed automatically and the payments can be made after the verification through the DBT system, which is based on the Aadhaar payment system, ABPS. So with coming of this, before building this platform, what we did was we did pilot with some open source platforms that were there, and that helped us in designing our system. We did a tender, we took a managed service partner, and they have been there for 3 years. Our development part is almost over. Now we are in the operation and management part. So initially, catering to the ID part, this system already has a unique health ID for all the patients, which once their ABHA ID is generated, it's mapped to that. So there is a seamless transfer of data. So a person who is coming to the hospital, if he or she does not have a ABHA ID, still he or she can get an ID, and once that ID is generated whenever, it's mapped to there, all the health records can flow through that. So when we started this journey, what we did first was we started digitizing our health facilities and the professionals. We brought them on the platform by using Government of India tools. and quickly we were the forerunners in that area. Then we, once that was stabilized and the system was in place, we started on the IPD side. OPD side was taken care of, then we went to the IPD side, then we went to the diagnostics, radiology. We went into it, not only integration in phases of things that we wanted to do, even geographically we did it in phases. We did not start it across Bihar, but we started with 2 districts, then with 8 districts, then with another 8 districts, and that way we expanded our horizon, and now we cover all the 13,000 health facilities that are there in Bihar. We have used extensively the Government of India Scan and Share to generate more than 43 million Abha IDs in less than an year, which is completely mapped to our UHID also. And the ASHA workers, there are around 90,000 ASHA workers in Bihar. Of them, 80,000 active workers are completely on the mobile applications. They're using it day in and day out. And when I'll share again about them, we'll talk about that. So, our experience has been that it has the technological input and the experiences of the and support from our partners, international partners also. Gates Foundation is one of our strong partners there. Government of India has helped us a lot, though we still face issues with integrating with certain of their APIs, because they're very, you can say they crib a lot about whether they will give the push part only or the pull part they will allow. Generally, they say that you can push the data but will not allow you to pull the data. But we are trying and working with Government of India so that is also seamless and that we can have. To have, once these things were in place, how do we monitor it? So it was not that we put the monitoring part later on. While we were doing all this, we developed a control and command center, a very, you can say, state-of-art control and command center with a 40 feet video wall, which has all the dashboards, integrated dashboard in one place. It has, we have CCTVs across the state in all the district hospitals. We can monitor the SNCUs, the kids that are being taken care of, the sweeping that is going on, the wrong parkings, people entering in and out of the hospital premises, everything we can map, we can monitor from the state headquarters from these video walls. We can track the movements of the medicines across, the ambulances across the state from these video walls. So this is helping us in monitoring and in making informed decisions. So we have practically utilized the ID part, the digital payment part, and the data management part. We are throwing in a lot of data, and we are now thinking of utilizing AI to help us get better insights into how this can help us in doing more informed, taking more informed decisions and policy planning. One example we can give is that there was earlier, the e-Aushadhi of the CDAC is already in place, and we were using it from before. Our platform came later on. But once we integrated our platform with this, now we can not only monitor the life cycle of the medicines, we can also monitor the use pattern of the medicines across the geography as well as the seasons in Bihar, when there are rise in cases of diseases, what are the medicines being utilized and which pockets. We have some endemic zones of Kala-Jar diseases and other AES diseases, so we can monitor that from our platform. These are advantages that we have. And as ma'am was speaking about the ASA, once we have integrated the platform of payment with this, we are actually thinking in terms that the ASHA worker will get their task in the morning, go and perform a task, and by evening she will actually know what she has completed, what she is going to earn from that, and how quickly. And that we are trying to do in a dynamic way. Presently it is on a monthly basis payment. We are slowly moving towards fortnightly payment, and then we'll make it more real-time payment for them. And even their superiors can monitor them through their Anmol app once it is integrated with the ASHA app. And they would, if there's a gap, the escalation can go to them so that they can complete the task on the behalf. Thank you, I'll take. questions.
Thank you, sir, for highlighting in detail about the implementation part in the Bihar context. And now we'll move on to Mr. Suhail Bidani. Is he online?
Can you hear me?
Yes.
Okay.
Yeah. Okay. Mr. Budani, we will be moving on to some of the ethical use of AI and how these regulatory frameworks needs to govern the ethical use of AI and big data in digital health globally and also in India. If you could throw some light into this topic. Mr. Bidani, shall I put forward the question once again?
He is muted.
I think you're muted, sir. Probably you need to switch on the mic.
Can you hear me now?
Yes, yes.
Sorry, the admin seems to have muted me. So
Okay.
anyway, yeah, go ahead. Sorry.
So I would like you to talk about the regulatory frameworks. What are the regulatory frameworks needed to govern the ethical use of AI and big data in digital health globally as well as in India?
Sure. Thank you. And I just wanted to start with an apology that I can't be there in person, but I'd love to. But glad that at least I can join virtually. Before I just respond to your question, I just want to touch a couple of things that were mentioned in the last one up. One, Sri Rohit Ratni said something which was pretty simple in a different context, but I'm going to pick the words. He said, if implemented right. I think that's an important piece of how we look at AI, and I'll bring the context over there. Raghu Dhanrajan talked about the common language, institutional infrastructure, and more importantly, its own distributed data architecture component as we look at especially on opportunities that lie for AI from here. So I'm going to, at some point, bring these back. And also, I think the point made by Ranjanji on the APIs, it's all linked, right? So how do we resolve for some of these things to ensure we maximize what the real opportunity lies ahead of us? Just to keep it simple, first of all, I don't want to differentiate right now what's the definition of AI here. In a more traditional sense, we've always talked about data science, big data analytics, and then there's this, what we call the post-ChatGPT era, the generative AI use cases, large language model use cases. I'm just going to keep it generic right now, not segregating, although very clearly the nuances associated with use of generative AI and large language model is something that we globally are still learning. We're still in a nascent stage of understanding all the risks and how to mitigate them. So there is some bit of additional scrutiny that is required. Coming back to the question that you asked, as I said, we're still in a learning phase, to be honest. The first and foremost thing is, do we have ethically available data which organizations working in the AI space can leverage to train models, come up with use cases, evaluate their own solutions, test them out? I think that's the first step. We just need to get that thing going. An associated component of that is around the required policies to make it happen. There has to be some bit of, I'm staying away from calling it regulation, but at least a clear set of policies that are out there which govern how this needs to be done and how the compliance is going to be measured and monitored. I think that's the first step. The second part to all of this would be to just clearly articulate how are we going to even evaluate solutions that are being developed or tools being developed for it, anything that you like, applications, etc. End of the day, we have a clear process on how to do this in the context of in a not technology world, right? So if I have to do this for, let's say, a drug or a vaccine or even a diagnostic device, there are clear sets of guidelines that are there. There are clear sets of processes, procedures which need to be followed. We just need to develop those, and it's all in making. We acknowledge the efforts that are going on, led globally by institutions like WHO and others, as well as in India, whether it's ICMR or Ministry of Health, and larger stakeholders in the ecosystem. So that definitely needs to be put in place as well. I think the third thing, which if we have to learn anything from our past, or rather past mistakes, is how do we engage with the user community early enough, and not just making a approach which is very top down. Anything that is being deployed, and I'm just going to take a example for now. If you're looking at deploying AI solutions in the public health context for any programmatic area, let it be identifying high-risk pregnancies or TB screening, you ought to work with the users in the field that are going to be using the tools that are being developed and get their inputs early enough to ensure that we are covering for various kind of risks that we may not see in a lab environment or sitting in a institution which is developing some of these solutions. So that's the second thing which I feel is very important. We as a country, at least I would like to believe that we would want to ensure that there's enough innovation happening in this space, and that requires some bit of that trust building to be also set up. Just taking one example, I think Raghu talked about data sharing per se. There are multiple initiatives that are on. We have the India Data Sets Platform under the India AI Mission, which the Ministry of IT is driving. There are similar initiatives being set up by other institutional organizations and bodies within the healthcare sector, including ICMR. How do we ensure that the data sharing across these platforms will also happen? And if I have to now extend it from the larger theme of the event itself, a similar thing can be set up across Global South. And I think it should be set up across Global South. The opportunity for us to do this effectively in terms of ensuring we solve for solutions across the Global South really lies upon how much of the data sharing element can we do. And I'm not saying expose all the data, right? Fully appreciating the sovereignty related issues that a country may have. But can we create anonymized, curated set of data sets that could be used by everyone? I think there's still a lot more optimism of that happening. I'll just keep it short now. My final set of comments, which I feel are not just related to the question of regulation. We need to have effective knowledge partnerships over here, which again is an opportunity of cross-learning that can be created. Some bit of it may happen at a country level, which may be sector agnostic. So AI Safety Institutes, for example, is one example of that. But can we do something similar, very specifically for health, and like-minded countries to come together? Finally, which is a universal thing we need to solve for, and this is not just an India-centric thing, procurement of these AI tools and solutions needs to be clarified. See, unlike the procurement of traditional IT services, AI systems can have very heterogeneous impacts. And there's a need for us to have rigorous checks, balances throughout the process, and then also ensure that institution, if a state government, let's say, has to agree on using an algorithm for chest, digital chest X-rays to be used for TB screening, they need to be very clear of how are they going to procure and differentiate between multiple options that exist. So some bit of that work that still needs to be done is to fine-tune the public procurement processes to enable this to get in a more real-world scenario. I'm going to pause here, but thank you so much for the opportunity.
Thank you, Mr. Bidani, for highlighting that, and also giving the importance of learning from the others. So we will now move on to His Excellency Mohammad Kamal Zayed. Sir, we would like to know from you some of the digital health innovations examples from the Arab Republic of Egypt, and probably for the Global South, what we could take it up.
Thank you, Dr. Rashmi. First of all, I have a confession to make. I believe that I'm on a disadvantage here because I'm sitting in a panel with such a renowned professors, and I'm only a humble ambassador from a country that is laying in a very quiet area of the world. So please excuse me for being, I'm happy to join, of course, this panel, and I will try to be I will try not to be boring. I will not try to say diplomatic word that is boring, and that would put you to sleep. So I will try to be focused as much as possible. First of all, I don't want to lose my diplomatic manners. I have to thank the state of Gujarat and the Indian Institute of Public Health for hosting such an important meeting. Actually, one of the reasons that I came here is to share our experience in the health sector. Ever since, we have a tradition in Egypt from learning from our history. We are a very modern state, so we have a history that to learn from, an extended history to learn from. We embarked from 2014 on a program. It's called the Decent Life, where we are trying, the government is trying to provide a decent life for all its citizens. And that includes one of the pillars of this program is healthcare. And in the pillar of healthcare, they are working now to digitalize the whole process, the whole ecosystem of healthcare services to the Egyptian people. And it's one of the components of this, or one of the reasons for this digitalization process is that we are trying to achieve health justice. What we mean by health justice is that we need to reach to all Egyptians in all rural areas where we can provide them with a good, improved health services. So this is one of the components of this program. There are four objectives. We are trying to reach all rural areas through the initiative is called the Presidential Initiative for Remote Diagnosis, where they would improve the health services through IT. We are trying to make an integrated medical services to all rural areas, and in order to reduce people who travel to go for long ways, for so many kilometers, to go to a hospital and so on and so forth, and the costs that is incurred by them. This program would also provide as a training basis for all the doctors, even in rural areas. And moving now to this program has achieved so many results. We have the health sector has improved, has been developing at a rate of 5.1% annually for the past 10 years, which is a huge number. The health sector has been, the role of the health sector in the GDP has increased exponentially during the past decade. It has reached something like 4 to 5% of the GDP. Though before it was one of the costs, one of the burdens on our budget, but now it is one of the contributors to the development in Egypt. Of course, one of the components or one of the reasons that I wanted to participate with you here is that we are not living on our own planet. We are living together, and health sector is not only about Egyptians, it's about Africa and our what we call Mama Africa in our continent. So we have embarked also on a program to export our expertise and our know-how to our brothers and sisters throughout the continent in Africa. And in that respect, we are hosting every year in the month of June a big exhibition and conference where we would bring all the ecosystem of the healthcare services in the world to discuss the challenges that we have in Africa. Healthcare services in Africa is a big market, and we don't look at it as a market only. We look at it as our brothers, and this is something that it's a social responsibility that we all have together to provide health to our brothers in Africa. This whole industry is worth something like $50 billion annually in Africa. And we are trying to export or provide them with the expertise and the know-how that we have in Egypt. And this is one of the components or one of the reasons that I'm participating with you today, that I'm trying to find a synergy between India and Egypt for the good and for the help of our African brothers and sisters, so that we can provide them with what we have together in order to really improve the health services in Africa, whether through digitalization, through AI, and so on and so forth. So this is one of the things, or one of the reasons that I was really keen to come here today to discuss with you. I will pause here, and actually this is one of the reasons what Professor Gulshan and Dr. Abha spoke about Global South. Global South, this is an example. My participation today, together with many of my African ambassadors and colleagues, one of the reasons is that we need to develop cooperation within Global South. We do not want to keep it, we are not speaking in a vacuum. We need to work together and to try to translate this into deliverables. So this is one of the things, and this is a very short answer to your question, and thank you very much.
Thank you, His Excellency, for summing up about what the digital innovations you're following in, and also highlighting about the Global South. I would come back to Shri Rohit Radish. Sir, are you online?
Yes.
Okay. Sir, I would like to come back to you with one more question. What are the governance models which can ensure the effective, inclusive, and equitable implementation of digital public health infrastructure at the national and global level?
I think I touched upon this in my initial remarks. I think it's very clear where India stands as far as what kind of DPI, be it payments or ID or data exchange, or even in the health sector, we would like to promote. You can read the letter of the G20 summit declaration, and it's very obvious. I think
Okay, thank you, sir. Now, to the chair, Shri Divedi, sir, I would like you to sum up the panel discussion with your insights, sir.
Thank you, Rashmi ji. I think we have got a very broad perspective about the topic. I must compliment Rohit for laying the thought process, emphasizing that the actual models, the actual implementation may be different, but the backbone or the concept or the platform that can be shared. I would also compliment Professor Gulshan, wherein he said that different cooperation models, for example, Global South, there will be similar many other models that can actually take leadership in working as bridge, in taking the best models or solutions which are there in different parts of the world and take them to each other to make it good for everyone. In the same context, His Excellency Kamal, he also mentioned about the best practices which are there in Egypt and emphasized that the practices or the models which can be replicated would there be almost in different parts of the world. The point is, how do we create or evolve the mechanism so that we can share, bring them together for collective good? That is what he mentioned. Professor Raghuram as well as Suhail Bidani, they talked about having a framework which has interoperability, scalability built in, not at the national level, but standardization at the global level. That will make sure that whatever gets developed, invested in one particular part of the world, that becomes accessible and available all over the world. Bhraguraj, Abaji, and Satish, they shared their experiences in terms of how in their respective domains they have made use of different platforms, frameworks, technologies available to make sure that the services which are delivered to citizens or to different stakeholders are made efficient. They have shared their own experiences, but that gives confidence that there are technologies, there are frameworks, there are platform and tools which can be deployed and leveraged to solve the problems or the challenges or the efficiency issues we face in our respective domains. So all in all, we had the opportunity of having a very diverse perspective. There have been examples about Aadhaar as the unified identity platform, the UPI as the payment interface, irrespective of bank or credit card at the back end, and now the ABDM. I'm sure there will be similar models and examples and platforms in different countries as well, which we will be looking forward to know and learn from you. So all in all, I thank all the panelists for giving valuable insights from their perspectives to different dimensions of the topic at hand. Thank you.
I would like to extend my sincere thanks to our esteemed chair and distinguished panelists, especially the ones who have also joined us online, for their valuable contribution to today's discussion. We are grateful for your time and thought leadership. I would now request our chairperson, Shri Dhananjay Dwivedi, to kindly felicitate our panelists, Professor Gulshan Sachdeva and Shri Bhraguraj Trivedi. I would now request our chairperson, Dr. Deepak Saxena, to kindly felicitate our panelists, Dr. Abha Mandirata and Shri Satish Ranjan Singha. I would request Dr. Rashmi to kindly felicitate our panelists, His Excellency Ambassador Kamal Zaid Kamal Kalal. I would now like to invite on stage Dr. Anish Sinha to kindly felicitate our chairperson, Dr. Dhananjay Dwivedi. I would request Dr. Medha to kindly felicitate Dr. Deepak Saxena. Requesting Dr. Purva to kindly felicitate our discussant, Dr. Reshmi. Thank you all once again for your participation and for making this session truly enriching. We would request you all to please rise for a photograph. We take a short 10 minutes tea break and we rejoin for the next panel.
check, check, hello, 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 check, hello, check, check, hello, hello, check, hello, check, 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 hello, hello, check.
હેલો હેલો હવે બરોબર છે બસ ના ઇકો નથી આવતો અત્યારે તો
Good morning once again and welcome back. Would request everyone to please take their seats for our next panel discussion. A very good afternoon. Welcome to our next session. Our next session is a panel discussion on India's health diplomacy in the Global South, the role of pharma and medtech industry. As India continues to play a leading role in global health diplomacy, the pharmaceutical and medtech sectors are key drivers in advancing the healthcare solutions and addressing the challenges faced by the countries of the Global South. In this session, our esteemed panelists will explore how India's robust pharmaceutical and medtech industries can contribute to health access, innovations, and partnerships in developing nations. They will discuss opportunities for collaboration, technology transfer, and the critical role of these sectors play in shaping the future of global health. I look forward to a stimulating conversation and insightful perspectives from all our experts. I'd like to welcome our chairpersons for this session, Professor Sanjay Zorte and Dr. A.M. Kadri. A short introduction. Professor Sanjay Zorpe is the president of the PHFI and previously served as the vice president for academics. As the founding director of the Indian Institute of Public Health, Delhi, he has played a pivotal role in shaping public health education in India. Professor Zorpe holds honorary and adjunct professorships at several prestigious national and international universities, reflecting his broad academic influence. For his outstanding contributions to medical science and public health, he has been awarded the honorary DSc by the DMIMS. Professor Zorpe has also been an active member of numerous esteemed panels, advisory groups, and technical task forces, contributing to policy making and advancing public health research globally. He has extensive experience and spans academic, leadership, research, and advisory roles, making him a key figure in public health. Welcome, sir. Our next chair is Dr. A.M. Kadri, who is the Executive Director at SHSRC, Gujarat. And he is overseeing the health planning, policy formulations, and innovations in healthcare since 2019. He leads the World Bank-supported Shrestha Gujarat program for health system reforms and has also the state program officer for the antimicrobial resistant containment program. Dr. Kadri has over 27 years of experience in community medicine and public health and has served as joint director of Gujarat State AIDS Society. He is the editor and of 3 editions of the IAPSM community medicine textbook, and he has held leadership roles in Indian Association of Preventive and Social Medicine, IAPSM, and was its honorary national president in 2023-24. Welcome, sir. Please welcome our discussant for today, Dr. Zahir Kazi, who is the Executive Director and in the Directorate of Research and Innovation at DMIHER. He is a distinguished leader and a clinical researcher and innovation, serving as the Executive Director at the Datta Mekhe Institute of Higher Education and Research. With expertise in health technology, maternal and child health, and biomedical engineering, he has pioneered clinical studies in tissue engineering and regenerative medicine, including customized implants and cranial grafts. Collaborating with leading institutions like IISc and IITs, Dr. Kazi has secured over 510 million in R&D funding from these prestigious agencies. A prolific author with over 250 publications in top-tier journals, he is recognized in Stanford's Elsevier's top 2% scientist rankings. Dr. Kazi's contribution extends to policy making for organizations like WHO and mentoring multidisciplinary teams to drive innovation and excellence. Welcome, sir. I'd like to introduce our esteemed panelists for today. Mr. Rohit Ratish is joining us online. He is the Joint Secretary, Development Partnership Administration Division 3, Rapid Response Cell, MEA. Mr. Rohit Ratish is a career diplomat with 18 years of experience working in the Government of India. He did his BTech degree in Electrical and Electronics Engineering from Kaikose, Kerala, and he has served in different capacities in Indian missions in Geneva, Port Louis, Kabul, San Francisco, and Mali. At present, he heads the Development Partnership Administration Division. And at the Ministry of External Affairs, he has worked in the Protocol Division as the Deputy Chief of Protocol Ceremonial and Joint Secretary in the G20 Summit. We are also joined by our next panelist, who is Dr. Pralok Gupta. He is an Associate Professor, Services and Investment at the Center for WTO Studies, Indian Institute of Foreign Trade, New Delhi. Previously, he worked with the UP state government and the Industrial Finance Corporation of India. He holds a PhD in Economics and Social Sciences from IIM Bangalore and has a certified FinTech and Regulatory Innovation Professional from the University of Cambridge. Dr. Gupta has also been deeply involved in policy making, advising the Ministry of Commerce and Ministry of Finance on trade and macroeconomic issues. He has been appointed to several key positions, including the task force on service sector experts and the interministerial subgroup on data in trade in services. Dr. Gupta is also an active contributor to the international journals and business publications, including the Economic Times, the Business Standards, and Live Mint, where his articles on contemporary trade issues are regularly featured. Welcome, sir. Our next panelist is Dr. Rajiv Chibber, who is the Vice President External Affairs at the Sajanand Medical Technologies Limited. Dr. Rajiv Chibber is a Senior Corporate Affairs and Policy Strategist with extensive experience across the pharmaceutical, medical devices, healthcare, environment, and developmental sectors. As Sajanand Medical Technologies, he drives the strategic priorities and business vision through engagement of government bodies, regulatory agencies, industry associations, and NGOs. A member of various committees on public health advocacy, sustainability, and medical devices, Dr. Chibber plays a key role in shaping India's healthcare and environmental goals. He holds a master's degree in journalism and mass communication, along with a doctorate in global public health communications and policy from Aztec University, Mexico. Welcome, sir. Our next panelist is Mr. Sumit Agarwal, who's the Honorary Secretary, Indian Drugs Manufacturing Association, Gujarat State Board. Mr. Sumit Agarwal is the CFO with Ishita Drugs and Industries Limited. As a second-generation entrepreneur, he has over 20 years' experience in the pharma industry, managing his family-promoted companies, both in the API and the pharmacological formulations sectors. He has completed his MBA in finance from NMIMS, Mumbai, and has also worked as a financial institution before joining this company. With a rich experience of API industry, he has been invited to speak on industrial matters at several platforms. As a member of various industrial associations, he has been instrumental in representing about issues faced by the industry to various government departments, regulatory authorities, and statutory bodies. He also holds positions such as Honorary Joint Secretary, Indian Drug Manufacturers Association, Gujarat State Board, co-chair of the GCCI Pharma Task Force, etc. Thank you. Our next panelist for today is Dr. Charu Gautam, who is the Senior Medical Director, Head, Early Clinical Development, Asia Pacific. Dr. Charu Gautam is a clinical pharmacologist with over 24 years of experience in clinical research domain. She has completed her MBBS from Sardar Patel University, MD, microbiology with a gold medal from Gujarat University, and a DNB in clinical pharmacology. Her areas of expertise include the design and conduct of early phase clinical trials, generic drug development, infectious diseases, and vaccine development. She has led cross-functional teams across continents and is invited amongst the think tank of her field. Currently, she is the Senior Medical Director at IQVIA and Global CRO. She has faced more than 50 regulatory inspections for clinical trials. Dr. Charu is invited speaker at various national and international conferences. Amongst her most recent achievements, she was awarded for her outstanding contribution towards clinical research during COVID-19 at the International Healthcare Conference held in Dubai, UAE in March of 2022. She is also on the panel for the review of drug development guidelines for international regulatory bodies. Welcome, ma'am. Our next panelist is Mr. Parth Kava, who is the CEO of the Medlira Healthcare Private Limited. Mr. Parth Kava is one of the partners of the Medlira Healthcare and holds a master's degree in biotechnology science from the Veer Narmad South Gujarat University. He has extensive experience of 12 years precisely in IVD sector and has experience and expertise and knowledge in vitro diagnosis. He initiated his career in the year 2013, and during his association with the leading diagnostic companies, he has earned vast experience in hybridoma technology for anti-sera and in the development of the various rapid diagnostics tests as well as ELISA test development. In 2020, he founded Biome Life Sciences, specializing in manufacturing rapid kits and raw materials. Leveraging this experience, he later established the Medlira Healthcare, where he contributes his expertise in research and plays a key leadership role. Welcome, sir. Joining us online is our next panelist, Dr. Harish Iyer, Deputy Director, Digital Health Innovations and AI at Gates Foundation. Dr. Harish Iyer is currently the Deputy Director of Digital and Health Innovations at Bill and Melinda Gates Foundation. Previously, Dr. Iyer was Chief Executive Officer, Strategy and Operations, the Santa Biotech Limited, part of Sanofi Aventis Group between June of 2011 to July of 2015. He is also the Vice President and Head of the R&D at Biocon. Dr. Iyer has completed his ex-ed leadership and strategy in pharma and biotechnology, PhD chemical engineering, and BTech chemical engineering from the Indian Institute of Technology in Madras. Dr. Iyer focuses on the use of health and digital technological innovations, including new product development and research partnerships to achieve the SDGs. Welcome to all the panelists as well as the chairs. I now hand over to the chair for their opening address, please.
Thank you. And it's my pleasure to welcome you all for this panel discussion, focusing on the role of pharma and medtech industry in the context of how we build on collaboration and cooperation between the countries and in the context of looking at from a perspective of South-South collaboration and cooperation. I firmly believe that this discourse would certainly help us to guide in moving forward the deliberation that we would have, that contribution and positioning India particularly in pharma and medtech industry for advancing the larger agenda of South-South collaboration will certainly be helpful. When you look at the contribution of pharmaceutical industry and medical technology in advancing national and global health, we really need to talk about the strong, vibrant and resilient health systems. And if we really wanted to have the resilient health systems, the focus on each building block of the health system remains critical and important. When we deliberate on building blocks of the health systems, we generally talk about 6 building blocks: human resources for health, health financing, health service delivery, health information systems, looking at also overall leadership and management and governance. But the 6th one, where we talk about medical products, vaccines and technologies, is so critical and important. So overall architecture of the health systems remains incomplete without talking about the medical products and vaccines and technologies and the role in advancing overall global health. India has played a very pivotal and critical role in last couple of decades, both from a perspective of a pharmaceutical industry, but also looking at medical technology. Recent example that yesterday also we talked about the vaccine production and development in India, and India's role, particularly in the COVID vaccines, not only from a national perspective, but for a global perspective also, a very key role that India has played and India will continue to play a role. Against this background, it is very important that today's deliberation would reflect on some of the key issues where we would dwell upon how India can position itself in advancing this overall collaboration from a South-South perspective. We are very eminent panelists today, coming from a very diverse and rich background, and I'm sure they would deliberate on some of the key issues which will help us to move forward. Before I hand over to Professor Kazi, who is a discussant and who would moderate the discussion, I will now request Professor A.M. Kadri for his opening remarks.
Good afternoon, everyone. So, as Professor Sanjay Jodhpe has rightly said the context about this entire plenary discussion, so very little I have to add, but I will be definitely saying when in childhood, when I was in the childhood, when we are seeing the doctor, so usually we are seeing doctor as one person having the knowledge and skills. But somewhere we are finding stethoscope and this sphygmomanometer technology is there, but we are facing the minimal technology support they are using. But back to the 21st century, I think this is the real century of the technology, and newer emerging various technologies have come up like anything. And definitely the scope of the application of this technology in the medical field, healthcare, is tremendous. It is said that the person who can use technology wisely, they are the winner actually. It is not the number, ultimately the use of the technology, and instead that matters a lot. And in fact, we are seeing the lots of scope in the technology. It may be at the molecular level, genetics level, or it may be at the AI level, the robotic level. Unfortunately, if we are seeing that there is so you can say that there is a vast spectrum of the applicability of the technology in the healthcare, but unfortunately the thing is that I am seeing that the two important sensitive sector, it may be the, I think, aviation sector and the finance sector. They have banking sector, finance means banking sector, they have adapted the way the digital technology in comparison to the health sector is remain, I think, way long back, I think. And the people who miss the train of the technology, they will be left behind. That we have to understand, and now we have to, I think, cover up whatever the loss we have made. And I am sure that we are having the eminent panelists. They are having a wide experiences, expertise, and they will share their views and experiences and also give some suggestions how we can adapt the technology so that we can enhance the healthcare delivery. Not only that, I am saying that the 21st century is the century of the technology, but it is also a century of the, I would say, supersonic speed. Everything is instant now. So definitely this deliberation will help us into guide us that we can have the policy platform, can create a policy platform or diplomacy for adapting the technology with the speed, scale, and sustainability. So I wish all the best to all of you, and looking forward to have the very fruitful and enlightening discussion from the eminent panelists. Thank you.
Thank you to both the chairs. It was a very apt and succinct discussion and opening remarks from this respected Honorable Jodhpe sir on the Indian farm, and you all are hearing how they are transforming the healthcare system all across, not only in Southeast Asia, but now globally. same way Dr. A.M. Kadri, he discussed on the role of medical technology and how we are trying to improve and transforming health. Now coming to further on, we have Shri Rohit Ratish, the Joint Secretary, Rapid Response Cell of Ministry of External Affairs. So we would like, it would be an honor, and we would like to hear your opening remarks on the, we know that the recent past efforts has been a lot of damage shown by India. So we would like to hear from you the Indian efforts to leverage the medical tech sector. Same way, we would like to know about the opportunities for collaboration between India medtech companies and government in the global south to improve the healthcare delivery system. Thank you, sir. I hope you are there, sir. Thank you. Shri Rohit Ratish ji. Voice, if they can be improved.
So your voice is not audible. Maybe you would want to either increase the voice or maybe
we
the
can modulate
organizers
from
here.
here. Yeah. Yes. Yeah. Much better than before. Yeah. If you can just-
which deals with long-term development what we have noticed in these exercises while working with our partners in the health ministry as well as with large health PSUs is that India today, I think, pretty much covers in terms of production the gamut of medical, of pharma, as well as medical equipment. I think we are about 8 to 9 months away, if I'm not mistaken, from India-made MRI machine in terms of full certifications, etc. And once these capabilities are built out within India, I think we'll be in a very unique position to 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 actually meet help global South countries meet their health related sustainable development goals. I mean, the cost of MRI machines, the cost of CT scans, the cost of medical equipment for global South countries is almost prohibitive. I think India can sort of blaze a trail in terms of affordability and accessibility when it comes to medical equipment as well as just the way we've done with pharmaceuticals. And I think this will have an impact of great scale in many global South countries where vulnerable populations exist. And not just those countries, but also within India as well. I think our own populations do require more accessible, affordable drugs as well as medical equipment. I think this is probably the gist of where we are in terms of our work within the Ministry on Health Diplomacy. Of course, we do health policy related frameworks. We work within the Quad framework. We work with the Ministry of Health and Family Welfare in the Pacific Islands on health related DPIs, on also on pandemic preparedness, sharing some of our platforms, the digital health sector with these countries, etc. These are works in progress. And I think increasingly health diplomacy and in particular our humanitarian aid in terms of both pharma and medical equipment will find an increasing resonance in terms of our diplomatic credentials as well as our ability to shift outcomes, change outcomes in the health sector for our partner countries. I'll stop here.
Thank you very much, sir. Thank you for sharing the great work the Rapid Response Cell is doing, leading to Sustainable Development Goals. We are very happy to hear that we are one of the first responders in many ways, and we have contributed to more than 45 countries, various parts, right from Latin America to Southeast Asia, Sudan, Ukraine, Israel. And the great work defense workforce is doing for providing all those essential medicines and the innovations we are doing, like for MRI within 7 to 9 months. It's indeed a way where we are progressing well, contributing not only to the South, global South, but moving across the globe and picturing and providing support in many ways. Thank you, sir. So thank you for being with us, sir. It's an honor to hear from you. Now coming to the second panelist, Harish Ayarji. He is working amazing works on digital health innovations and AI. Our question the audience would like to hear more about is, yes, we do think we are now the emerging global leaders in AI-powered drug development. So how India positions itself, we would like to hear from you, sir. Harish Shriji.
Thank you so much. I hope you can hear me clearly.
Yeah, that's totally great. Thank you.
Okay. Thank you so much. I just want to start off by saying that, India, start off first of all, thanking you very much for inviting me to this panel. Obviously, India ranks, very high worldwide in terms of probably number one, I would say, for production and volume of drugs to reach the lower and middle income countries, and actually quite a bit of the drugs that reach the high income countries as well. I think we are third largest in terms of volume of drugs, although because our drugs are quite inexpensive, even relatively speaking, they are lower in terms of value compared to the volume. I think, and I want to link that to, of course, the recent cabinet decision by the government of India to allocate more than 10,000 crores for the India AI mission. And a part of that will go into, the money will go into many things, but also setting up centers of excellence for exploring the use of AI and such innovative technologies in the healthcare sector. I think I would like to point out that, maybe I'll talk about 3 or 4 things. One is, new drugs. Second is designing new proteins, and I'll explain what that means. Third could be designing new vaccines. And the fourth one would be, potentially new diagnostics. And I'll speak very briefly on each of these. And I've picked one condition. For example, in drugs, I will say that in the future, as we think to the future, antimicrobial resistance, both in vertical programs, such as tuberculosis and malaria, but also more broadly against specific bacterial pathogens, is going to be a huge, huge challenge. And it's something that is going to be very, very important. And I'm not even including pandemics and things like that. How can AI help with all the data on epidemiology? And this is very appropriate, given that this talk is occurring at, the IIPH. How can you predict outbreaks ahead of time? How can we collect data from the many strains that are being sampled around the world, around the country, at various levels and health facilities? And do we know what is happening there in terms of the key pathogens that are coming out? To solve for these, to treat these new pathogens, I think we'll have to really think about new drugs, across the board. I just want to, remind everyone that we recently had great news around nafithromycin, which is a antibiotic that came out of Wockhardt. It's not yet been approved by DCGI, I believe, but it's in quite late stage of review at the CDSCO. And I also want to add about another company called Bugworks, which is based out of Bangalore, which has also recently published much earlier stage data on a novel antibiotic candidate that seems to have widespread utility. So I think these kinds of, and I think these kind of new drugs, and I think there was also a recent drug that Zydus Cadila worked on, Zydus Health worked on quite closely with Medicines for Malaria Venture, which is also a new drug. So I think there is a very nice combination here of, Indian companies and institutions and academics interested in new drug development and the possibility that such new drugs could be developed using AI technology. What does AI provide you? It provides you with ability to screen in silico large numbers of candidate molecules. It also helps you understand structures of targets. That is, all these antibiotic molecules are targeting a particular structure. For example, maybe it's a topoisomerase enzyme or other such candidates. And how can we dock them in silico? How can we optimize things that we will be able to develop, shorten the speed to get to animal trials or other trials much more quickly. You have millions and millions of compounds. Your computing capability, your modeling capability is going to make a huge difference in that case. And talking about proteins, I'll talk a little bit about designing proteins, and I'll refer to a recent news article that came out on Jan 15th in the magazine Nature, where using AI, scientists designed proteins. Essentially, these are anti-sera, anti-venom molecules, proteins, if you will, that can neutralize poisons and wielded by cobras and other venomous snake. And it's a proof of concept that you could use AI to design proteins from a blocking perspective, and in the future you could imagine developing antibodies using AI that have better capacity, that can maybe live longer. You're giving 10 doses to a patient, you could give only 1 dose perhaps, or you could give a lower dose. All of this is supremely important because especially all over the world, but especially so in health system that may not be able to follow somebody up for 10 times. So I think there's a tremendous amount of possibilities in terms of designing proteins. I think it would be great to think about how Indian industry and Indian academia and the government and broader public society can encourage this kind of thinking. It's something that would be playing very much into many of our strengths in computing and capabilities in digital. Talking about proteins, I want to go to the next level, which are other proteins or even RNA and nucleic acid type vaccines that could be truly revolutionary in terms of improving capability. So I talked about AMR earlier, I talked about TB, malaria very briefly, but could you design vaccines against TB, malaria, against these very many pathogens, which could be proteins or it could be mRNA or DNA type constructs or even adenoviral constructs. And there is some work going on in India in the startup ecosystem to look at using AI tools to design and develop scaffolding. One such company that I'm aware of is PopVax, a small startup in Hyderabad that's looking at novel antigen design against COVID and looking at broadly finding an antigen that can give you broadly neutralizing capability against a virus strain. Why is this important? It's important because it seems like a virus like COVID, and I know we've all forgotten about it, but this is a future pandemic is always possible, and we have to always be watching out for it. Can we use AI and AI tools to develop antibodies that will vaccine which will create antibodies that can overcome this broad constant evolution of a virus? Is there a possibility there? That's something for us to think about. And I think here again there's a lot of interesting work on using AI to identify adjuvants. So vaccines often don't act just by themselves, but there's something added to them called adjuvants, which can increase the immune response of a particular vaccine. So in the world of COVID, there were a lot of new adjuvants that were tested around the world, including in India by Bharat Biotech's vaccine had actually a novel TLR agonist adjuvant. BioE's vaccine had a novel adjuvant as well, which was a CpG adjuvant. So these adjuvants are super important, and can we develop the next generation of antigens or adjuvants using AI is another key question, very much relevant to how do we improve the efficacy of vaccines. We do know that there are vaccines that are being used in the lower and middle income countries, and in India in particular, where sometimes they don't work as well. Could be either both have new designs as well as new adjuvants for this. Lastly, I will come to the topic of diagnostics. Diagnostics, for example, AI is one of the great things that AI can do well is recognize pictures and images and interpret them hopefully quite well. And this is a key element of many of the public health works that we do. One such example is looking at algorithms that can interpret X-rays in settings where sometimes you might not have a radiologist easily available. Would there be a way to use such imaging methods to improve and triage at a lower level in a health system? And I can think of multiple examples here. You could imagine that you could do this with TB, for example. Maybe a frontline worker taking an X-ray of TB, of a lung of somebody who's suspected of TB, and can it improve the triaging of that patient? Should they go, is it something routine, or do they need to go and visit? And I know that ICMR recently has notified that we should try and look at some of this in the broader TB program. But there could be other examples. You have a stroke, you want to understand where what's the medication you need for stroke. There's something that is important from a timeliness perspective. I was recently visiting an organization that was looking at that quite seriously, looking at AI to interpret and figure out what type of a stroke it is. Third example could be in pregnancy. Are there methods that you could use imaging, or maybe even without the image, can we look at options of understanding are there risks during pregnancy using AI tools? And the AI question is much broader. You can imagine cardiac health, something that measures your cardiac health in much simpler methods because the AI has the capability. Again, lots of options here in terms of health, and I think it would be great if India, with its extraordinary capabilities in computing, in mathematics, in data availability, develops strong research in this area, and it's a potential part of the new future health economy. Thank you very much, and I'll stop here.
Thank you very much. It was very exciting, Dr. Harish Ayerji. Those are very encouraging insights you have given on AI capability, computing, data, and research. And we have been wonderful to hear that we are the third largest drug suppliers at such a low cost, volume increasing so much and reaching to all parts of the world, and exploring AI in new drugs, new proteins, new vaccines, and adjuvants. the main is also the thought process which you have imbibed is our AI and epidemiology and outbreak predictions. Indian Institute of Public Health is doing great stuff on climate change prediction. So we are working on that part as well. Looking at the various companies which are coming up, like you mentioned, of Works and Quocard and Zydus. That's really exciting about the future we may have, and that may be AI may be a part of all the public health experts in coming future. Thank you, sir, for joining virtually, and we thank you very much again. Thank you, sir. Now, coming to the next panelist, we have Dr. Pralok Gupta. And we would like to know that we are aware that recent amazing works has been done in which India has done a lot of capacity building in healthcare. We would like to know about the initiatives which we have been taking in training, infrastructure, R&D in the global south, so that our audience can really understand the works which we are taking, initiatives we are doing. Thank you, please.
Thank you, Chair, Co-Chair, and the discussion, and thank you to the organizers also for this invitation. So I pick up from our first speaker, Mr. Rohit Ratish, left discussing the government to government aid to global south. So one part is when we talk about the developing capacity in the global south, particularly in the context of healthcare systems, is the help provided by the government, and that is based on the humanitarian, and that is based on the free of cost or in the form of aid. But when we talk about the private sector, which is the topic of today's panel discussion, also the role of pharma and medtech industry. So this is mainly in the private sector. And when the private sector is involved, usually it has some kind of commercial motive. And when there is a commercial motive, then there is a role of international trade. So how the international trade rules are framed, how they can help the developing country, that country in the global south, that becomes very important. Now, this international trade in health or health system, that has two aspects. One is when we are trading in the goods part, which is like your pharmaceuticals, drugs, or the machines, diagnostic tools, like. The other is the software part, which is the healthcare services in the form of the actual treatment, the doctor's consultation, nurses, and other thing. So traditionally, these healthcare services, they were considered as very sensitive in most of the countries. And there are reasons to believe that thing, because it is a matter of consumer safety, the lives of patient, then obviously there is sensitivity involved. But I often speak when I speak on this trade, international trade in health services, that though it is sensitive, but having a robust trade mechanism for healthcare products, drugs, as well as healthcare services is a win-win situation for both the countries. Unlike other goods or services where generally people think that exports are good because you are earning money from other countries, and imports are bad because your money is going out of your country, in health services, it is a win-win situation, because the exporting country, they earn money from other countries, but importing country, they also earn the good health of their citizens. And these citizens, when they are having good health, they can be employed in their workstations, and they can be more productive, and in the way contributing more to their economy. So it's a win-win situation for both the countries. So here, when we are talking about the international trade in services and international trade in pharmaceuticals, India is always a champion of cause of global south, the developing countries as well as the LDCs. In that World Trade Organization, which is a multilateral trade organization having the international trade rules, in terms of the drugs, pharmaceuticals, we are always considering that the intellectual property rights, they are supportive so that the drugs can be produced at a lower cost, and they can have equitable access, they can be given to the other countries. So one example is that when this COVID pandemic broke, then we supported that there should be a waiver from the TRIPS, intellectual property protection, to the new technology, new developments in terms of therapeutics, in terms of the diagnostics and vaccines. And along with South Africa, I think yesterday, Madam Kadri was also mentioning this thing. We took up this effort, and I can say proudly that the proposal that we submitted in the WTO, my organization, Center for WTO, was the brain behind that proposal. So we worked very hard because it was very difficult to convince developed countries when we have a great lobbying from the MNCs because they have their profit motive. So it was really very hard, but we, to some extent, I would say definitely to a great extent, we were successful in achieving that objective. Even from the services perspective, in the ministerial declaration of the WTO, there was mention of the telemedicine, role of telemedicine, and also the building the pool of healthcare professionals. I'm sorry. So there also India submitted 2 proposals on healthcare professionals as well as the role of telemedicine. Now these, like building of healthcare professionals, these are very important from the global south, because many times there are shortages of skilled healthcare professionals, there are shortage of the new technology, shortage of the digital infrastructure for telemedicine. So we discussed so that there is an opportunity, so the countries in the global south as well as overall at the global level, there is an equitable distribution of these resources. The third aspect which we have taken was which was discussed in the WTO in 2008 and agreed later on, the LDC services waiver. So in the WTO there is a concept of most favored nation, that whatever treatment you are given to one country, you are supposed to give that treatment to all the WTO members. Now if you are a country is giving a preferential treatment to LDC country, then it will be violative of this MFN provision. So in when this LDC services waiver was discussed in the WTO and the LDC's countries brought this proposal, India was a very hard supporter of this proposal, that we can provide preferential treatment to LDC countries. And India was the first country to extend significant preferences in terms of capacity building, in terms of technological collaboration, in terms of their professionals, healthcare professional and other professionals working in India. So that was one of the important things that India wholeheartedly supported for the global south. Not only in the context of WTO, but outside the WTO also, we are champion of having low-cost production for drugs and pharmaceuticals. I just give you one example, though it was not in the context of the LDCs or global south, but that has implications for global south. Like very recently in 2022, we signed a free trade agreement with the UAE. So in the UAE, we managed to have a provision which is very important for the pharma and medtech industry, that if a particular drug is approved by US FDA, so then that UAE will not require further inspection or the medical or preclinical trials or preclinical inspection for those medicine, and the market access authorization would be given within 90 days. Now this was a significant achievement, because as we have said that our objective is to produce the low-cost drugs. Now if there is significant clinical trials or medical inspections are involved, that obviously will going to increase the cost of drug delivery. So if other countries can have this kind of mechanism, and I just take clue from other thing like UAE, there is a provision that if you are having a visa in US, you are having a US visa, then you can enter, you can go to UAE and have a business visa right at the Dubai airport. The same thing we are having, that if there is a genuine or like there is an approval from US or Canada, then we need to reinvent the wheel. We can rely on that mechanism, and then the inspection or the approval can be given quickly. Now this has implication for the global south, because if our pharma industry, our medtech industry is in a situation to produce low-cost drug, then these can be given or these can be exported to global south at a lower cost. So affordability becomes relatively easier. So that's why these kind of arrangements are very important. So India is always a champion of cause of global south, and this is no action for the health services, whether it is the drugs manufacturing or drug supply, pharmaceuticals, or from the health services. We are always creating a platform for the better availability and affordability through international trade to developing countries and LDC in the global south. Thank you very much.
Thank you, Dr. Pralok Gupta, sir. Thank you for sharing your insights and the concepts on privatization, globalization, commercialization in the trade. And the best part is how to make it a win-win situation and make a robust system, and what are the differences within, particularly on differential treatment. So we are end up to you for sharing your insights. Thank you. Now moving to the second panelist, Dr. Rajiv Shibar. Amazing discussions we had in the early morning, and we want to continue that same in the same vein. About the work he was sharing about the startups, the industries which are working in India, and the indigenous built in India work which is happening. So particularly in the area of diagnostics, surgical equipment, implants, and the medical device which is booming across. And not only that, we need to know more from him about the untapped potentials in India which are still hidden, and he wants them to come out with his great efforts and his team's efforts. And also China is dominant, so India also is very much pursuing that same work, and we also want to be the global suppliers and have to have a dominance in the medical device globally. And for all this, we need a workforce and a good industry academia partnership, which we do really wish to have in the coming decade. So we want to hear from him how the steps are being taken and what are his insights. Thank you. Please.
Thank you very much, sir, for the questions. I think it's a it's a loaded question in one question. First of all, thank you, Professor Zodpe, for the opening remarks. I think he set the context very well, that when India, a part of the global south, and not only a part of the global south, but a part of the global diplomacy in healthcare, we've emerged as leaders. And what Mr. Rohit Ratish said and Dr. Gupta said, I think we've done immense work in terms of how India is looked at when we look at not only health tech, but now with the Prime Minister calling the medical device sector or the medtech sector as the new sunshine sector that is growing very well. So, largely, let me just give you a small context around this. This entire health diplomacy is, as Mr. Rohit did say, started almost way back in the 80s, but post-COVID is where, there's been a lot of traction for health diplomacy to be really taken forward. And we created an entire ecosystem where at that point of time, in addition to what was the requirement of vaccines, the entire medical device industry was also geared up to provide the equal amount of equipments to a large part of society and globally also. So, medtech at that point of time was not recognized. As an anecdote, I'll just tell you, almost like 7 years back, one of our member companies, I also represent IMED, which is Association of Indian Medical Devices. So we have around 780 odd manufacturers who are a part of this entire IMED consortium. So under IMED, one of our member companies almost like 7 years back created a very advanced hazmat suit. It is like an advanced PPE kit. I wore it and I pasted my photograph on Facebook, and I had almost 200 plus comments where everyone said, are you going to Mars? Moon ja raha hai kya? Kya plan hai bhai tera? Naukri chhod raha hai? Are you becoming an astronaut? So that was the level of understanding that people had maybe 7 years back or 9 years back on what medtech was or medical devices were. And today, all these PPE kits and, the disposables, consumables, the electronic equipments, the implants and the IVDs have become a household name, and we are moving much forward from that, and we're coming to point of care diagnostics where everyone sitting in home wants to have a diagnostic kit in front of them to know whether they have what's the disease and what's the gravity of the disease. So that's the kind of attention that medtech has now had. from something which was looked at a dwarfed cousin of the pharmaceutical sector to now being a household name. So it's really evolved very well over the past couple of years. And we are, I mean, presently, if you look at it, we are a $14 billion industry right now. And we're looking at, by the end of 2035, we will be a $50 billion industry. The medical device industry itself will be a $50 billion industry, where we are adding more medtech to our stealth, where we're looking at not only point of care diagnostics, but even the IoT and IT enabled medtech devices or apps, which Professor Iyer just talked about, becoming a part of the entire global conodrome. Now, I think when we talk about diplomacy in the South-South diplomacy that Professor Zodpe was alluding to, it's very important that associations and industry be a part of the entire TRIPS WTO program. And fortunately, earlier when countries like US, Japan, India thought of creating the TRIPS WTO and related forums, the industry was made a silent consultant to it. But today, if you look at it, from an industry perspective, organizations like us are a part of not only the Quad Alliance, we're a part of the ASEAN FTA, the BRICS FTA, G20. India showed the real prowess around how healthcare diplomacy could be taken much forward, because it was the primary agenda after maybe defense and security ties. Health was the primary agenda which G20 took forward. We're a part of the now the new Indo-Pacific trade agreement that is going on, and we're leading the entire discussions with the US and related countries, where we're looking at how to look at a China +1 strategy. Because that's something that I think is bothering the world also, where we're looking at quality devices. We're looking at devices which are affordable, available, and accessible, as there's a global demand for it. But also looking at how can we circumvent our dependence on one particular country in that sense, whether it is for new drug discoveries, whether it is for the medtech sector, or now even for the supply chains, as you alluded to. We're trying to look at how we can really look at supporting the LMIC countries, the low middle income countries that are now not having the wherewithal to create that technology and the tech transfer which is going to happen. So all these is a part of the entire healthcare diplomacy that the medtech industry is looking at too. From additional points, if you look at a point that you talked about, which is how India can come up to become a global player into it, I think harmonization of regulatory standards is what we are looking at. When we talk about US FDA, CE marks having a superiority against possibly our own CDSO certifications, we're looking at how can we globally scale it up to a level where the acceptability is completely absorbed in most of the countries. And when you talk about the global south, there's a huge lot of countries that we are talking at, right from the LATAM area to maybe the Oceania area of the world. So if we have a harmonization of regulatory forums, that is going to be a major win situation for India. In fact, I'm not sure, but if the audience here knows, in November 2024, India became a part of the ICDRA, which is the International Consortium of Drug Regulatory and Alliance. So, which means that we have inched towards becoming a part of the entire global conodrome of not only drug discovery, but medtech harmonization also. Another part that we're actually growing great is how we are looking at employability. So the second part of your question, which we looked at. So I think when we look at a global diplomacy, the first thing that comes is how are we going to have the professionals engaged into it? And the first part is the kind of professionals that are required in a particular industry. And the second part is how those professionals can make an impact to a global population or the global policy discourse in that sense. So I think I take it in a very personal manner when we talk about AI, which is artificial intelligence. The first thing that we need to start before looking at AI is to develop a new AI, which is, academia industry relationships. Once we have that sorted, I think our professional expertise to really look at manufacturing practices, quality practices, and even global diplomacy practices on policy impacts and discourses is going to be sorted. I'm a part of the SCALE committee, which is, the standing committee on advancing local produce and employability. It is a part of the Department of Commerce's DPIIT's stance, where they are looking at not only advancing local content in India, where when I talk about local content, it's how local manufacturing can be increased. That's the first part that Rohitji talked about when he talked about the MRI machine being made in India is going to be a reality. And yes, it is going to be a reality. We have, through the production link incentive schemes under the Department of Pharmaceuticals, under the MedTech section itself, we have almost all high-end critical MedTech devices now being made in India. And the misnomer that India is almost like 85% dependent on medical devices has actually gone and reduced to 63% in the high-end category. And if you look at, the class A and class B devices, which is, largely disposables, consumables, or surgical equipments, we are net exporters, which means, the amount of export is really surpassed of what the internal consumption has been. And there's through this Metri, MedTech Mitra, and the entire Sanjeevani efforts by the Honorable Prime Minister, we've now become a place where globally, not only the African continent, the Latin continent, but even in the Southeast Asian countries are being sourced from the Indian subcontinent itself. So these are areas, but then largely when you look at the academia, we have just got an announcement through the Prime Minister of 100 crore corpus to be given to the NIPERS, which is National Institute of Pharmaceuticals, and IIT Kanpur and IIT Delhi. With them, there's going to be now a consortium of academic institutes, and I do hope IIPH, with all its branches, becomes a part of the entire efforts, where we are looking at having more medtech ready professionals. The issue was that when the medtech industry starts, attracting professionals, we largely get a B Pharm or an M Pharm kind of a professional who understands only the drug part of it. We are very different from drugs. Our regulations are very different from drugs. We need to have someone who understands medtech, metallurgy, and its impact on human health. So the kind of biomedical engineers that we require, the kind of allied health workers or technical workers who can work in possibly a cath lab and understand how frequently you require catheters to be moved in and out, or an implantation of a stent, or how you look at high-end diseases like an aortic transplant to be done or a heart transplant to be done. All this is something that we require them to understand. So unless you understand the entire conodrome of metallurgy, technology, it's only then when you will be able to understand healthcare dynamics. And lastly, I think we're very much thankful to not only the Government of India for propelling the entire free trade agreements and making us being a part of it, but through various initiatives. I think in the last 2 odd years, right from the medical devices parks that have been announced, to the bulk development parks that are being announced, to even supply chain acoustics, which India is taking forward with not only the Pacific countries, with Europe, with the Far East countries. We are trying to become one of those critical countries where we can supply not only quality equipment, but we can make accessible equipment at a lower cost, even during times of wars, pandemics, and epidemics. So the part where Rohitji was talking about the rapid response cell, we are supporting the rapid response cell through the Department of Pharmaceuticals, through the DPIIT, which is the Department of Industry Trade Promotion under the Ministry of Commerce, and obviously the Ministry of Health and Family Welfare through the DGHS, Director General Health Services. And thankful to also the states. I mean, look at Gujarat. I mean, they're coming up with the MedTech Park in Rajkot. an entire ecosystem is being created where not only testing facilities are there, but also academic institutions are being aligned. So I think this entire conundrum becomes a very big boon in terms of how alignment can be done at the grassroots level in India, and then we proliferate to the global level. So thank you very much. Thank you for this.
Thank you, Dr. Rajiv. So much to learn from him. He is an amazing person and creates a lot of vibrancy and understanding on this very difficult topic of taking the medtech ahead. And he has spoken a lot about like global health diplomacy and then the immense work which we are doing in more than 780 manufacturers and eye health consortium, and how we are not only in that, we are also putting our heads on changing the economy right from 14 billion to around 50 billion in very coming future. So that's amazing, and the work which we are doing with G20 health is also a very leading discussion and providing not only the quantity but at an affordable price, reaching to the unreached and unprivileged population in such difficult circumstances like pandemics or wars. We all are hearing all this with the harmonization and the CDSCO and the approvals which are required. There has to be of the international standards so the other countries can adapt them more quickly and without much problems, so that not only in Global South but globally also we can play a role to help those people. And then after that he discussed wonderful things about workforce. So it's all about multidisciplinary team, that doctors, engineers, social scientists, and all the pharmaceuticals coming together, playing their own role and also contributing to each other to develop this type of medtech, and the Rajkot medtech park which is coming up, which will create vibrancy in Gujarat, enhance the capability of not only Gujarat but also of the surrounding states. So much to learn, and thank you very much for joining us and sharing your thoughts. It's a whole day we need to hear from him. Thank you very much. Now we have Mr. Sumit Agrawal. We know about COVID and we have been speaking about that, and that India's pharmaceutical industries have played a major role. We all know about that. And we would like to know how this role of Indian pharmaceutical industries can do more to support the healthcare in Global South, and how we can address the challenges, as Dr. Rajiv was speaking again about affordability, accessibility of essential medicines and medical devices and vaccines. So we want to hear more from him. Quite a big question, but because of lack of time, we would like to ask you too many questions at the same time. Thank you very much, Mr. Sumit. Please.
Thank you. A very good afternoon to all the participants. Before I answer your question specifically, I'd like to give you a brief idea about the strength of the Indian pharmaceutical industry. We are today an industry of USD 50 billion, of which about 25 billion is our exports from India, and we hope to touch about 450 to 500 billion by 2047 when we celebrate 100 years of India's independence. We are the third largest manufacturer of pharmaceuticals in the world in terms of volume, but being largely in generics, we are about 14th in terms of value of pharmaceutical production. And that is why we are known as the pharmacy of the world. And the reason we are so strong is we are producing high quality pharmaceuticals at very affordable prices. And that is why we are the go-to country when any medicine or any pharmaceutical is needed across the world, especially in the Global South. I think Mr. Rohit Ratish talked about essential medicines in times of disasters being faced by natural disasters being faced by many countries, or shortages of particular medicines being faced by countries. These are the times when Indian pharma industry steps in. We supply essential medicines, whatever is required, and many times these are provided free of cost to these countries. In case of shortages also, some countries directly we get requests from the embassies of various countries, the association gets requests, and we make sure that those countries get whatever medicine is required. As mentioned earlier, we are producing practically the entire gamut of medicines in India. Some of the, one of the most notable achievements of the Indian pharmaceutical industries in its support to the global south has been the supply of antiretrovirals, which are required for the control of HIV and AIDS. If I take an example of Africa, it probably has the largest caseload of HIV and AIDS patients in the world. There was a time when 1 in 1,000 patients of HIV could afford anti-HIV treatment. You know, the cost was about $12,000 per patient per year. This is when Cipla back in 2001 stepped in and said, we'll offer this treatment at less than $1 per day. The treatment cost offered by Cipla was $350 per annum per patient. Now that was a significant breakthrough. As recently as 2017, Aurobindo and Mylan, another two generic manufacturers from India, they offered the prevailing HIV treatment at, I think, $75 per patient per annum. Now this has brought the treatment of HIV to every patient. I think somebody talked about the SDG goals of 90-90-90. If we talk, getting 90% of the patients to access to HIV treatment. This is where India has played such a significant role, and if today Africa has been able to control HIV and AIDS, a large contribution, and the large contribution is of the Indian pharma industry, Indian generics pharma industry, which has made affordable anti-HIV drugs available to the larger population. Talking about vaccines, I think we all know of the COVID vaccine Maitri that India employed at that time, supplying vaccines to about 100 countries. But what is not so known is that we also supplied a lot of medicines at that time, hydroxychloroquine and paracetamol tablets to almost 90 countries, most of them in the global south. We also supplied diagnostic kits. I think Mr. Parth Kawa would know much more about that, but we supplied diagnostic kits, masks, other medical supplies. We deployed personnel. And this is all on the strength of our pharma industry that we were able to do that. Another example was Remdesivir. Indian pharma industry was able to ramp up supplies so swiftly that we were able to cater to the needs at that time. That is all because of the strength of the pharma industry. If I extend the example of pharmaceuticals and vaccines to healthcare, India has a very well-developed healthcare ecosystem at a much affordable rate. And we are the go-to country, again, a preferred medical, what we call medical tourism destination for countries in the global south, for our neighbors, let's say Bangladesh, Maldives, Sri Lanka. The healthcare system, the hospitals that we have, we are the preferred destination. There are other countries, let's say Thailand, with a very well-developed healthcare system, but the costs there are 10x, 15x of what India is offering. And so India is a preferred destination. We even hear patients from Pakistan coming to India for the medical treatment, and India is always giving those medical visas. So India, I must say, has never weaponized its strength in the pharmaceutical sector and has always been supporting the global south in these matters. Again, another area that is emerging is of telemedicine, where again India has a very good role, important role to play. India has set up telemedicine centers in various countries, Seychelles, Egypt, many countries, other countries in Africa, where they are being connected to super specialty hospitals in India. Doctors in Africa can upload case papers and documents, diagnostic reports on that system and get live guidance from doctors in India. So again, this can, if this kind of cooperation increases, this can be again a game changer, because ultimately, if we want the access of medicines to increase in all these countries, we have to support the health infrastructure. If we improve the health infrastructure, only then the medicines can be accessible to the larger population. So this is what the strength is. This is how we are supporting the global south. As far as the challenges, I think you mentioned the second part of your question about the challenges that we face to continue to supply these kind of medicines. So one thing is what Dr. Pralok Gupta said, that TRIPS and WTO, India being a signatory, we cannot offer certain medicines because of patent restrictions. After COVID, many countries have started insisting on local manufacturing by incentivizing local industry and probably putting some kind of restrictions on imported medicines. So the way out for that, and the next step for the Indian pharma industry, would be to set up local manufacturing in these countries. If we do that and set up and help improve the infrastructure in these countries, that is where the real support will come to. And again, coming back to Dr. Gupta's mention of LDC exemptions of TRIPS. So we can supply latest patented medicines in those countries by manufacturing it locally, and that is how we can avoid the trap of patents and something that prevents us to offer low cost medicines to these countries. So that is one thing, because many of you might remember we were supplying medicines to LATAM, South American countries, and during transit the medicines were confiscated at Dutch and other European ports because they were infringing the patents in those countries. So this is something that we have to work on. This is how, if we have to supply to everybody, we have to work with the TRIPS regime and find ways to provide medicines at affordable prices to other countries. Another key challenge for us is going to be the supply of APIs. You might know that today almost 60 to 70% of APIs are being imported from China, and we have a heavy dependence on China. The government of India has taken a lot of steps post-COVID to improve this, to reduce this dependence on China for our APIs. So it is utmost essential that we develop this API ecosystem, API and the KSMs, and manufacture them locally so that we have continued access to these APIs, and we can, based on that, we can continue supplying to countries all across the global south. I hope that has answered your questions.
Thank you. It was very indeed a great pleasure to hear from you, Dr. Sumit Agrawalji. He mentioned about twice go to country, so it's really so happy to hear about that. And sometimes even free of cost essential medicines are being provided, and more than 90% of achievement has been there, contribution from India to curtail HIV/AIDS, particularly in African countries, and mention about medical tourism and preferred destination in comparison to Thailand. And we are not weaponizing the medicines, but even welcoming Pakistan patients coming to India and getting those benefits. That's a wonderful story. And not only that, in the indirect way, he mentioned about how it has been able to, because of affordability and accessibility, reduce cost and poverty. Like SDGs, they are contributing in SDGs. And doctors do get all the thanks and wishes and gratitude from patients. But Indian pharmaceutical industries have played a major role, because of which we are getting, the doctors are getting all the gratitude and wishes. If we had no medicines during the time of COVID or for HIV/AIDS, we could not would have received so much accolades and gratitude and wishes from our patients. And the capability he mentioned about in Global South has to be enhanced so that we can have the local industries there build their capacities, and they can take the shoulder, the pain and the efforts they can take up and then build their own nation. So that's wonderful points he came across. So thank you very much. It was wonderful to hear from you. Now coming to our next panelist, let's see how we can wrap up quickly because the time is short. So Dr. Charu Gautam, our question would be that, yes, we are maturing and have been showing transparency in guidelines recently, but how we can enhance them, because the credibility has to be enhanced so that we can match with the global world, with the global practice, and where does the CRO industry stand today. So that's a very prominent question the audience would like to hear. And at the same time, the leverage, the contribution which the CRO is working on healthcare, in healthcare diplomacy, that's what we would like to hear more from you. So thank you very much. Thank you.
Thank you, Dr. Kazi. So good afternoon, everyone. I know it's close near lunchtime. I'll try to answer your questions in the shortest possible time. The CRO industry is in India is now more than 2 decades old, almost a quarter of a century old, and we have seen a real growth and then a fall, and now a sustained growth in that industry. And the reason I'm saying about this curve is because, as Dr. Kazi mentioned, that there are new guidelines in place, but when we're talking of clinical research, we're talking about experimentation in humans, and this is a very tightly regulated industry, and the data integrity as well as safety and well-being of patients is of utmost importance. Given this background, the guidelines need to be very stringent, as well as the training of the professionals involved in clinical trials need to be very, very stringent and focused. So in 2013, so when the industry started in the late 1990s or 2000, early 2000s, it was a very, very booming industry, and there was a lot of trials in India. India offers a lot to the clinical research industry in terms of reducing the cost of trials. When we're talking of manufacturing drugs, one of the most expensive part of the drug development is the clinical trials, and that becomes a rate limiting thing for pharma industry as well. And that is where India pitches in as in doing cost-effective clinical trials, because one, we have a large pool of patients and a huge disease burden in our country. Second, we have a very good infrastructure of healthcare and a good pool of medical doctors and super specialists who can actually conduct the trials. And being in an English speaking country, it also helps in reducing any data that is lost during translation. So that these are certain attractive points where India becomes a hub for clinical trials. And we've had over the past 2 decades revised guidelines to be able to manage the expectations of the global clinical trial industry. And the latest guidelines that have come in place is the new clinical trials rules in 2019, which is very comprehensive, and it is in line with the global guidelines. And in fact, it also protects the local population by introducing very unique clauses like compensation for clinical trial participants, which is, I think India was one of the first countries to include that in the clinical trial guidance. So given these benefits that India has, it can really add to the pharma industry's quest to become a world leader by reducing the cost of clinical trials. And when we look at the generic pharma industry, we say that 40% of the generics in the US are from India, or 25% in the UK are from India. And all these generic clinical trials are done in India, not only for the Indian companies, but also for the global generic industry. India is a hub for doing the clinical trials. I was at a session with the US FDA where they were talking about India, and they mentioned that almost 70% of the generic drug trials data is coming from India, and it has been hugely accepted by the US FDA, and the products are being marketed. So these are the highlights that we have for our achievements. But when we're talking of health diplomacy, and especially global South diplomacy, where we are supplying generics to the world, we also have WHO who comes in and approves a lot of our clinical trials. So there are inspections for the plants as well as for the clinical trials. and we have met those standards as well. And how do we leverage this? Well, there's a lot of talk about use of AI, and when we're talking of AI, we are also looking at unmet medical needs in countries like India as well as Global South, which are termed as orphan diseases, where there may not be enough drugs available, or if they are available, they are too expensive for the populations in the low and middle income countries. And the recent the focus of Indian government on the rare diseases has shown us success of launching 4 drugs for rare genetic disorders in 2024. That is for lysosomal storage diseases, phenylketonuria, thalassemia. And believe it or not, the cost of these drugs is 60 to 100 times less than what was available in the US or in the Western world. So that gives a huge benefit to our patients who need these drugs for their lifetime. And it also gives a huge benefit when we share it with the Global South. So these are the benefits that we can leverage from the CRO industry, supporting this. Also, as we were hearing Mr. Harish Iyer speaking about AI, artificial intelligence is now widely used in the design of clinical trials to be able to, identify the correct endpoints and use algorithms which would help us to limit the number of patients that we are actually enrolling into trials, thereby reducing the timelines, reducing the cost, so it would have a dominoes effect on the overall efficiency of the clinical trials that we conduct in India. So these are some of the points that I'd like to make here. I hope I've been able to answer your question, Dr. Kaz.
Yeah, thank you very much. It was very exciting to know from her, particularly on global trial and global guidelines, and the various stringent efforts are being made by Indian CROs, and the work which we are doing on experimentation, data security, data privacy. It's just amazing to hear that USFDA is claiming that 70% of the generic data is coming from India, and that is a very negotiable point for us in the Global South to why we should have those expensive drugs when most of our data are from us. So you can't just take the data and in return we get hardly any few benefits. So we can have that capability of negotiating and creating those opportunities for the Global South, where we can have our local expertise developed and then negotiate and see that we have affordable and accessible drugs which are required by our Indian population. So that's indeed a very good insight she has put across, and we would love to keep hearing from her about the progress which we as CROs are doing in India. Now, thank you very much for those comments, and now to Mr. Parth Kawa, the last panelist. We would like to know about the leverage and innovation in rapid diagnostics to strengthen the health diplomacy, and what are the public health challenges in the Global South, and how the government is supporting this pharma and medtech companies in overcoming those challenges in innovation and research. So we would like to hear from him so that we can learn a lot from you. Thank you, sir.
Hello. Good afternoon, everyone. I would like to thanks to organization for invite, and especially thanks to the panels, right? And very special thanks to the Dr. Rajiv ji, as we are from the same group of industries, as a Sahajanand group of industries, right? And as a Medlera Healthcare, we come from like pharma and medtech industries, right? We, if we talk about the pharma and medtech industries, that means innovation. Innovations for to address the global challenges into the, especially in the Global South, right? According to the WHO report, right, the 50% of global population is just out of like a diagnosis. So diagnosis is the main part that we can say for the addressing all these challenges, especially into the public health, right? With these challenges, we took that and addressing specially kind of technology, not so the bigger technologies as like industries, especially into the PCR, ELISA, and so and so. That bigger machines require especially for that. Here I want to talk about that 50% global population that is are just apart from this all the diagnoses, we can say the laboratories and all, they are just lack of it, right? So here we introduce the rapid diagnostic test. The rapid all are we are got introduced the rapid diagnostic with the COVID-19 test, right? So let me discuss about like what if vitamin B12, vitamin D, and especially the HbA1c on rapid test. We are the first in the globe to introduce the HbA1c on rapid test. Now just imagine on at your home as a POCT, point of care test, you can test your HbA1c at home. Just we are the first to launch HbA1c in the globe. And if we talk about the other diseases, the critical life-threatening diseases as like HIV, HCV, and SBSAG. So here we introduce a rapid diagnostic test. In the single test, we can differentiate the HIV, HCV, and SBSAG within 10 minutes. So just imagine, we are about to launch that products. And if we talk about the South, Global South, and the tribal area, so the as we know, there is a problems of malnutrition, vitamin B12, vitamin D, ferritins, and sickle cell anemia, thalassemia. So here we are launching around 78 types of products, especially in the Medler healthcare, just on the based of rapid diagnostic test, right? So it is a time constraint. I will not take much time, and is the government and especially they are supporting, as we are all aware about the Ayushman Bharat and other schemes which is offered by the, especially from the honorable prime ministers and the honorable chief ministers. They are giving the schemes and the subsidies for the industries, for the innovation and affordability tests and so on. Thank you. I will not take as it's lunchtime. Thank you everyone for the wonderful audience and participants. Thank you.
Thank you, Mr. Prath. It was indeed a great pleasure to hear from you, and the way you were able to put up what innovations and rapid diagnostics we are doing. That's really heartening to know, and we need to work on that. And we have showed the world that we are capable and we are moving ahead in that direction. Thank you very much. So we had two virtual panelists who wonderfully explained through and discussed about the facts, and with including five who are sitting in front of you, the panelists. Now, the concluding remarks are very important because of the rich discussion we had. We were enlightened with that, and we request first with Dr. A.M. Kadriji to please put across his concluding remarks, and then followed by Honorable Professor Sanjay Zodpe, sir. Thank you.
Thank you. So I think it was very enriching discussion. I think eminent panelists from diverse domains and expertise, they have, I think, bring in and given insight in different areas. I will be just summarizing in 1 minute by 3 threes and 1 1, I will be saying. 3 threes is that what has come out of the discussion is saying that there are 3 important stakeholders. One thing is the definitely academia, another is the industry, and the third is the government. 3 pillars for this, I think, this medtech and the pharma industries are this R&D, then productions, and the availability and the accessibility. And 3 important approaches for global, I think, diplomacy is on the funding maybe for the R&D, funding like incentive support for the PLI, something like, or technology transfer, and the very much important is the trade. So these 3 areas we need to be focused by global policy, and which is focusing on having the good policy, rules, and the support system, focusing on one, that is the people at large, so that everywhere this medicine and the device required, and everyone who is in the need are getting this thing. So thank you very much for this wonderful discussion.
Thank you, Professor Kadri, for this summarization. Truly, it was interesting and enriching discussion. We heard all the diverse perspectives on the role of pharma and medtech industry in advancing the larger agenda in South-South countries. We heard multidisciplinary approaches where we talked about multi-sectoral interventions. And it's also important to learn from all of you, and you highlighted some of the challenges and problems, but because we recognize our national bird is peacock and not the ostrich, we have to look around what are our problems so that we can fix those problems to move forward. And also wanted to say that because finally what matters is that the science is sterile if it lacks the social relevance, and all policies would crumble and cleft it if they are not firmly placed on a pedestal of valid science. And from that perspective, also it's critical and important largely to look at the equity and the impact of the work that we all do and move forward. It was wonderful listening to all of you, your views. I'm sure that would help us to move forward larger agenda. So back to the organizers. Thank you so much.
So, sir, I'll want to end with one small thing. Now, normally when we talk of developing a larger partnership, PHFI and IIPH has always been there at a harbinger, and we call it as a real PPP model. And it's not the public-private partnership model. It's a partnership for a public purpose that is always looked at. Thank you.
Thank you, Raj.
I would like to extend my heartfelt thank you to all the esteemed panelists and the chairpersons for their valuable contributions in today's discussions. We truly appreciate your time and thought leadership in this enriching and important conversation. I would now request our chairperson, Dr. Sanjay Zodpe, to kindly felicitate our panelists, Dr. Pralok Gupta and Dr. Rajiv Chibber. I request our chairperson, Dr. A.M. Kadri, to kindly felicitate our panelists, Mr. Sumit Agarwal and Dr. Charu Gautam. I would now request Dr. Zahir Kazi to kindly felicitate our panelist, Dr. Parth Kava. I would invite Dr. Purva kindly on the stage to felicitate our chairperson, Professor Sanjay Zodpe sir. Dr. Shabana Khan to kindly felicitate our chairperson, Dr. A.M. Kadri sir. Invite on stage Shri Mahendra Chaudhary, CEO, Nidhi TBI, to kindly felicitate our discussant, Dr. Zahir Kazi. Thank you all once again for your participation and making this success. I would like to request you all for a photograph, please. We now break for lunch. We will see you on the other side of the break. Between 2:30 and 3 p.m. after the lunch, there is a networking through the stalls and Make in India pavilion. We see you in our next session.
Hello. Hello.
Check, हाँ.
એટલે આમાં કેવું છે મારી અવાજ આવે તમને? હલો હલો ચેક બરોબર તમે બોલો. એટલે તમે અહીંયા છો ને એટલે આ ફીડબેક આવે છે એટલે આવે ને અહીંયાથી એટલામાં પાછળ જતા રહો પાછળ. આવે જ છે. હા તમે અંદર જઈને બોલો વિડીયોથી ચાલુ કરો. હા
Check.
હવે એ જ ઓડિયો પાછો આપવું છે મારે અહીંયા એટલે રિપીટ થઈ એટલે આ આનો ઓડિયો કાઢ નાખ ના કાઢીશું તો અહીંયા જતું રહેશે. આને છે ને સેપરેટ આપતું હા સેપરેટ કરશો તો વસ્તુ થઈ જ આવશે ને આવશે. એક જ મિનિટ હો જિગ્નેશભાઈ એક કરી દીધું ઓકે છે હવે ના ઇકો નહીં આવતી તમારી કન્ટિન્યુ બોલો તો કંઈક થોડું આવે છે થોડુંક આવે અહીંયા આવે છે ના ના અહીંયા પણ આવે છે. હા 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 ઓકે
એનું બાજુ ખુલ્લું છે ને બારી.
અચ્છા હા હા વાંધો નહીં ઓકે ડન છે તો પછી હા આમાંય બે ઓડિયો તો કેમનું આપ્યું છે
અહીં આઉટરીચ તમારે પેલા નેશનલ એન્થમ બધું આમાં લગાવવું પડશે.
અચ્છા એવું છે ને
લગાવી દઉં એનું તો કોપી કરી દઉં.
તો ઉભા ના પણ એક જ ઇનપુટ છે લે યાર.
ચાલશે હું આમાંથી આનો આઉટ પ્લે કરીને જોઈ લઉં એકવાર.
હા જોઈ લો ને.
લઉં ખરો નહીં પેલા એક લેવા દો ને યાર મને.
Hello, hello. Hello, hello. Hello, hello.
ના હોય.
अभी नहीं चाहिए हर्षदा का पेपर देखना है ये अभी नहीं चाहिए ये प्लीज
ठीक है यार देखो
वो सॉरी और मैम करेंगे
ठीक है देखो मैडम ये है ना यहीं से होगा ऑपरेट
वो उनको बता दो
कौन है
वो दोनों सर और मैम है ना वो ब्लेजर में मैम है
हाँ
और उनके साथ वो
क्योंकि
सर
यहाँ से है ना मतलब प्रेजेंट हम यहाँ से नहीं कर रहे आवाज़ और ये सब जाएगा ये पीपीटी वहाँ है मतलब यहाँ से वहाँ का कनेक्शन है क्योंकि हम
वो
इनिशियली
यहीं खड़े होके उन्हीं को राइट राइट करना है
बस
ना
बस बस वही करना है
हमारा स्टाइल है
Good afternoon, everyone. I, Priyanka Shah, welcome you at our post-lunch session. Now, we will be having a presentation on Dakshin, Global South Center of Excellence Research and Information System for Developing Countries by Dr. Gulshan Sachdeva and Dr. Monica. Sir, madam, may we please have you on stage?
Good afternoon, Excellencies, ladies and gentlemen. I am Professor Gulshan Sachdeva, Chief Coordinator, Dakshin, which is Global South Center of Excellence. Dakshin, as you can see, it stands for Development and Knowledge Sharing Initiative. And the story behind Dakshin, I think in the morning also we were discussing, and it has been referred a couple of times since yesterday. During India's G20 presidency, India also thought that large number of countries from the global south, very few countries, big countries were part of G20 from the global south, but large number of smaller and other countries were still not there. So Prime Minister had this Voice of Global South Summit in January 23, where about more than 120 countries participated at various sessions. And during that session itself, Prime Minister announced that India is going to set up a Global South Center of Excellence. Later on, of course, the Dakshin was also added. And then, when we had the second Voice of the Global South Summit, as Prime Minister promised in the second summit itself, by that time, Dakshin was already set up, and he himself personally inaugurated Dakshin, this Global South Center of Excellence. Dakshin at the moment is part of another major institute in Delhi, which is called RIS, which is Research and Information System for Developing Countries, which is a 40-year-old institution, which is basically working on India's external economic engagements in the areas of trade, investment, technology, finance. And also, they have also created a huge database about India's development cooperation activities, and they have been working for decades about South-South cooperation. So it was found fit that maybe to begin with, Dakshin can also work within RIS, and then perhaps depending on how we grow, we can also become independent in the long run. So we are here, we are independent office in the India Habitat Center in Delhi. So when Prime Minister established this, while inaugurating, he said that this center will focus on research related to development issues of developing countries. Through this initiative, we were looking for the practical solutions of the problems of the global south. So it means the idea was that there are solutions within global south. How Dakshin, we are trying to work it out there, how we can really accelerate, become a multiplier of some of those initiatives, some of those solutions which are in the global south. And in the third Voice of the Global South Summit, again Prime Minister referred that already we have Dakshin Global South Center of Excellence is working, but then he also gave a new concept, which was called the Global Development Compact. Because so far India has been working basically, India's external engagement with outside in the development sector, mainly in the three areas. where we work with either through capacity building, the ITEC program, or we are also working through grant in aid projects. And then there are also certain other humanitarian aspects, or the major program is also about lines of credit programs to other developing countries. But here, it's a much more holistic concept, where the idea is it's not just only about this, but how trade could also be used for development purposes, how we can really facilitate trade for other countries, how we can also share technology with other global south countries. As I was saying in the morning, that global south today is very, very different. You know, the large number of technologies now flowing from the global south. Large number of investment is also coming inside the global south, and from global south itself is also going to other countries. So how all these things coming together, becoming a global development compact. So it means Dakshin is now trying to work out within this philosophy of global development compact and dealing with and engaging with other countries of the global south. So broadly, I mean, serving as an accelerator and multiplier of all the developments which is taking place in the global south, how do we are trying to facilitate all kind of cross-continental exchange of ideas, development of evidence-based policy frameworks. Similarly, today in the morning we're talking about, the public infrastructure, digital public infrastructure. These kind of public goods, how we can really ensure within Global South the availability and accessibility all these global public goods. Similarly, transformational opportunities for development cooperation within the context of what the development compact he was talking about, and also really how do we really learn from each other. So there are basic certain objectives, we really worked it out, and the way we have actually now having conversations with other Global South partners at Dakshin, mainly in 3 areas. One is, since we have been now dealing with large number of think tanks of the Global South, and large number of them also work in the development sector. So first in the area of policy research and policy dialogue. So if we find that some of those think tanks in the Global South, because they are think tanks, so they do work in the policy research, so maybe we are actually working with some of them to develop common policy issues. And then we also have a couple of webinars, seminars, etc., the policy dialogue, particularly related to the policy issues. Then in some of our partners, they are also asking, we are also working on certain kind of capacity building and skill enhancement projects. So we'll see what kind of requirements are there within our Development Partnership Administration of Ministry of External Affairs. We also have a large capacity building ITEC project. If some of them align with them, we try to help them, tell them that these are our programs, maybe they can get benefit from this. And if these are something very specific, very different, we'll see how do we really facilitate those kind of training programs or other skill enhancement projects. And then the third one is about technology sharing. So if there are certain projects where we are talking about, within the IT sector, within the digital solutions, all the things, many things which we have talked since yesterday, we have this grant assistance projects within Government of India, but now many of those things are also within the private sector. Some of the things may happen within the multilateral organizations. So we are trying to work out some of those project proposals and see from where, how do we really facilitate from the Global South and also for perhaps from the other partners as well. The activity focus for the last 1 year or so we have is, one is, first we were given the priority countries, the countries which really participated in the Global South summits. So it means the countries which were there, particularly the smaller countries in Africa and other places, our kind of focus was on there. Then we also went, while talking to them, what kind of priorities they have. So we try to align those countries with those priority, their own priorities in certain areas. And then after that, we are trying to work out what kind of really projects can really come out after the conversations we have with them. So already, we are not very old, but what you can see, we have already made a remarkable start. We are collaborating now with more than 36 think tanks of the Global South from 85 countries. This is the agreement which has already been signed, but we have although in fact talking to many others, because some of those institutions are semi-government or very close to government, so sometimes it takes time in those cases to process those agreements. So we are actually talking to close to 200 those global think tanks with which we are trying to build our collaborations. So you can see in different areas, this is the divisions within the Ministry of External Affairs. So we have worked actually according to them, because this is the list we received earlier, that these are the countries. So clearly you can see that the agreements of the think tank where we are collaborating more with East and Southern Africa, Latin America, Central and Western African division, and some other divisions now we have to focus slightly more, particularly in the Eurasian region, or in other East Asian region particularly, because the focus initially was really on the smaller other developing countries in Africa. And this is what you can see our Global South outreach. Already we have within by Dakshin to all different countries in the Global South. And these are the think tanks actually, we have signed already agreements with them. So you can see some of them, these are very different kind of think tanks. Some of them work in the development sector. Some of them are very mainly working in the security field, in the foreign policy or those kind of issues. But still our focus in the beginning has been on the development sector, but we are also trying to align their preferences in our conversations with them. So these are, again, you can see think tanks where we have really signed in the last 1 year or so. Now, initial focus area for 1 year, this was basically in 3 areas. We were basically having conversations with them in the area of agriculture, in health, and also in the digital solutions. But now, and we also have actually 3 advisors already in place. Health advisor, Dr. Monica Kocher is here. There are other advisors in agriculture and also in the digital solutions. And but now we are definitely moving into other areas, because there is a demand for other kind of work as well, mainly in education, connectivity infrastructure, climate finance and technology. In fact, all these areas we have not identified. These were identified by the Prime Minister himself when Dakshin was announced that Dakshin will be working in these areas. Since we thought in the beginning we identified these 3 areas, but now we are slowly moving into other areas as well. So what we do is, we have done many of those webinars with them, because it's relatively easy for us having with our Global South partners. Last 1 year was mainly in the first 3 areas in which we were working, in agriculture, health, etc. Just 2 weeks back, we have one webinar with them, particularly on how to improve your cyber security issues for the digital public infrastructure. So many of the participants from the Global South, those are our think tank partners, they participated. On 23rd, we are going to have something on sustainable agriculture, so many of those issues are happening. We created certain 3 base policy papers in these 3 areas in which we work. These are basically just describing all the major flagship projects what we have in India, which we feel are successful projects. So this we have shared with all of them, that this is what exactly India has been doing. And then of course we are also asking them what kind of areas, what kind of projects, what kind of initiatives their governments are doing. So we are trying to compile those as well. Then we also have another initiative which has been there even before us. This was a Development Cooperation Review. This is a peer-reviewed academic journal. So all development cooperation related issues, it's not just only policy paper, these are theoretical articles and academic articles. We discontinuing. That has also been one of our work. We also produce a weekly newsletter, which is available on our website. So every year, every week, what we do is all the major stories from the Global South, particularly the positive stories from the Global South, how Global South, what kind of initiatives in different countries are happening, what kind of cooperation is happening. So we are also producing those, we are kind of compiling every week. So this is what we have done so far. So what we are really going to do now in the next few months to 1 year. One is Prime Minister himself had announced when he set up Dakshin that we are also, Dakshin every year would be organizing a major international conference of all the Global South think tanks. So now we have, already collaboration with 135 think tanks. So we are actually preparing for that major, all those partners should come to India, and then we'll see what we can do. We are also, as I said, now expanding into other 3-4 areas, because there is a lot of interest now, in particular in the connectivity and education, climate technologies. Sector-specific workshop discussion papers are continuing. And then some of the new initiatives now we are going to start, and actually we'll approach all of you for some of these initiatives which we are going to start now. We are going to start our podcast series where we'll be discussing specific issues concerning Global South. Then we also have Global South special lectures where people, those who are working within India or outside on Global South issues. So those we'll be inviting them for special lectures or particularly for roundtables. Then we also are now working on creating a Global South network of scholars. So we have already identified about 50, 60 scholars within India, those who are working on Global South. Because ultimately we will be known once we have created certain solid work, getting into the Global South narrative. So all of them, and then we will also be approaching scholars outside India, within the Global South, or even outside Global South, those who are working on Global South. So this network should be in place very soon. Then we are also going to have a media module for Indian journalists and also journalists from the Global South and also from the Global North, because what we really find sometimes is that understanding of developmental issues within the media is relatively limited, and what India is doing, what Global South is doing is not properly represented. So we'll have our own module, and then we'll also keep feeding them the kind of news we will collect about Global South, and then perhaps this is how the narrative of Global South and the way perceptions from the Global South will go further. And in fact, we had many ambassadors in the morning here, so we are also going to start a dialogue series with all the ambassadors of the Global South. So let them come and talk to us, what do they feel about Global South, how do they see where the areas, their own understanding as a policy makers. So these are some of the initiatives which we are going to start. Now only one thing before I finish, one thing in the last, whatever my interaction has been with all the global think tanks so far, my impression has been that, we had, as you can see, the initiative we have about 100, 160 think tanks. We have all the different conversations with them. The way Indian policymakers or Indian scholars, I find in the last 2 years, the last 2 days I have seen, we are eager to tell our story to others. That this is what we have been doing, whether in the area of digital, whether in the area of agriculture, anywhere else. The same story everywhere else in Global South. Everybody else is also eager to tell. We saw today in the morning, His Excellency, Ambassador of, from Egypt. Every country is doing something. They feel they are doing very good. And interestingly, they have all young populations, all different kind of experiments they are doing. So everybody want to share their thing. And so one has to be patient even to hear them. Everyone, that this is what you are doing. Then only we tell them that this is now, we are also doing something. Let's see, where can there is, sometimes you find very interesting thing what they are doing. And, and another thing also, after all the conversations with them, actually I found, the broader things, like when we say our digital identity, Aadhaar, or other big things about India's digital stack, they know about this, many of them. But only thing they're trying to understand how India is really building from one digital identity to something else, to something else, to something else. In fact, that was the story also in India. Many years back when we introduced Aadhaar, we didn't know what to do with this. And then later on, now we said that becomes the kind of cornerstone of so many other schemes. So this is exactly, they are doing something, and then they feel how it can be used for something and something else. And these are the things I think is very useful. And in conversation, you find that they also find something more interesting, which sometimes we don't notice here. Like when we discuss with them that, yes, we have, identity, issues about Aadhaar, but we also have another program, the Pashu Aadhaar, where you have identity tags and or identity for livestock. And I think they were very interested. Many of the African countries, they said, this is something very interesting for us, because many of the conflicts in some of those countries are about livestock. They move into one border to another. So they would really like to know, how you are implementing those kind of schemes. And of course, there are other particular schemes about e-Sanjeevani, telemedicine, etc. I mean, these are interesting. So the overall, what actually I find is that they know about this, that this is what India is doing in IT and in pharma sector. That story is quite well known by now. But how they can also build their own systems, linking what they have already and what we can really, and similarly from some bigger countries, how we can really work with them, those countries which are closer to them, because they also feel, whether you work with South Africa or you work with many other countries within their own areas. So this is the kind of thing I think we are doing. But since, this is, conference is about health, and I have a health advisor from Dakshin with me, so she might briefly can tell you what the kind of proposals actually we are getting from them in the health sector. Dr. Monica Kocher.
Good afternoon, everyone. Thank you, Dr. Sachdeva. I'm Dr. Monica Kocher. I'm Advisor Health with Dakshin, Global South Center of Excellence. So I'll start with where Professor Sachdeva left. I mean, we've reached out to nearly 135 think tanks. We've already signed LOAs with them. They are all placed in some 85 countries. And we've already explained them about the concept of Dakshin, everything about Dakshin, what is the mandate of Dakshin actually. And they are quite acceptable to that initiative. So after signing the LOAs, we have graduated to second level engagements with these think tanks. And it has underscored the importance of a platform like Dakshin. The 3 points which became clear with these discussions which we had with these think tanks is the points which we discussed in the morning, they have been clearly validated. That is, the Global South countries, they have similar challenges in healthcare sector pertaining to health challenges in health infrastructure, human resource paucity, or they are struggling with accessibility to healthcare services. The second point is that Global South countries, they have realized the hegemony of West and are ready for South-South cooperation and realize its importance. They're also, I mean, even though there are challenges, the challenges are similar, but there is a realization that whatever the solutions are available, they have to be modified, they have to be adapted as per the population needs of that particular area. These solutions have to be scalable, sustainable, and economical as well. And the Global South countries, they are open to the idea of this cooperation. So just to explain you that Dakshin Global South Center of Excellence has 3 things in its mandate. The cooperation goes through capacity building, the knowledge transfer, and transfer of technology. So these are the 3 ways we are going to conduct this cooperation with the Global South countries. And just to give an overview of the kind of proposals we have started receiving, something like we received a proposal regarding preparing a policy brief and regulatory framework for human milk banks in Armenia. Then the other one which we received was a case study to investigate the status and potential for integrating immunization and nutritional services into primary health care to reduce infant and childhood morbidity and mortality. This was one from Somalia. From Bolivia, we received a study to do a study in digital innovations for patient-centered healthcare in Bolivia. From Tanzania, leveraging science, technology, innovation, and health financing for maternal and child health, a Tanzania-India partnership. So this could go through capacity building, joint researches, holding webinars, conferences, and so on and so forth. We've already explained all the think tanks about our initiatives like eSanjeevani, we talked about UWIN, CoWIN, Ayushman Bharat Digital Mission, PMJY, and other innovations which we have done in the vertical of maternal and child health, communicable diseases, as well as non-communicable diseases. So the whole ecosystem is open to them. And we are also open to the innovations which are happening in these global south countries. We are open to the ideas how they have, worked on unmet needs of their country and how those innovations could be adapted by us as well as other global south countries to improve upon our systems, our innovations. So the collective goal is to strengthen the healthcare system and making this system more accessible, efficient, and equitable to the global south countries, and take forward the legacy of India as Vishwa Bandhu. Thank you so much.
Thank you so much, and thank you for giving us this opportunity to introducing Dakshin to you. We are open for any questions or something, but if there's any time, otherwise, anytime you can write to us, we'll be very happy to answer. But of course, the kind of initiatives we have listed, I think we'll like your participation in all of them. We'll be approaching one by one, depending on where do you find that actually would be useful to working with you. Thank you.
Thank you, sir and madam, for explaining about what Dakshin is and its way forward. Do we have any questions for sir or ma'am?
All right, thank you.
So now we move on to our next panel discussion, role of private sector in strengthening the health diplomacy of India. As India continues to expand its global health influence, the private sector plays an increasingly important role in advancing health diplomacy. From innovative healthcare solutions to strategic partnerships, the private sector contributes significantly to India's ability to address global health challenges and foster international cooperation. In our session, our expert panelists will explore how private sector engagement can strengthen India's health diplomacy efforts, particularly in areas such as healthcare access, technology transfer, and capacity building in the global south. I look forward to the thought-provoking insights and discussions ahead. As we move forward, I would like to invite our chairs for today's session. I would like to invite Dr. Amarjeet Singh, sir. Sir is an IAS officer of batch 1982. He has worked at various positions in different departments. He spent considerable time in Department of Health and Family Welfare, where he was instrumental in fostering public-private partnerships like the Chiranjeevi Yojana. Sir has also worked in Government of India, where he contributed in strengthening the blindness control program. and is the recipient of Prime Minister's Award for Excellence in Public Administration in 2008. He was instrumental in setting up RERA Gujarat and has served as its chairman, taking many proactive initiatives from the home buyers. Sir played a pivotal role in establishing our Indian Institute of Public Health, Gandhinagar. We welcome you, sir. Our next chair for today, Dr. Pankaj Bhardwaj, is the head of School of Public Health and Vice Dean Research at AIIMS Jodhpur. He also serves as a professor in community and family medicine with over 200 publications to his credit and an Edge Index of 55. He is listed among the world's top 2% most cited scientists. Sir is also an editor-in-chief of the Indian Journal of Community Medicine and editor of Polypharma in over 60. His contributions to public health encompasses implementation research, geriatric care, NCDs, tobacco control, and vaccines. We welcome you, sir. I would now invite our discussants for today. Dr. Lalu Joseph is a mechanical engineer turned healthcare leader in the quality manager and associate GS of Christian Medical College, Vellore. With a doctorate in business administration and credentials from IIM Bangalore and Canadian Healthcare Administration, she is a passionate teacher and ISQA expert. Madam has received numerous awards, including the Young Quality Achiever Award and the International Medal for the Asia Pacific region. Thank you for joining us, ma'am. Our next discussant for today is Dr. Medha Wadhwa. Dr. Wadhwa is a dedicated health management expert and assistant professor at the Indian Institute of Public Health, Gandhinagar, where she leads the Center for Quality Improvement and Patient Safety. Ma'am is an ISQA Fellow in Patient Safety and certified NABH Internal Auditor. Dr. Wadhwa's research comprises more than 40 publications and several book chapters reflecting her expertise in health system strengthening and quality enhancement. We welcome you, ma'am. I would now request Dr. Medha Wadhwa to kindly introduce our panelists for the session.
Good afternoon, everyone, and I welcome you to this last panel. I would like to welcome our panelist, Dr. Parth Desai, COO, KD Hospital, Ahmedabad, an accomplished healthcare leader with diverse expertise in strategic planning, healthcare diverse delivery systems, and financial acumen. He brings extensive experience in managing healthcare facilities and fostering educational initiatives. We welcome you, sir. Our next panelist on board with us, Dr. Paraga Rindani, Group CEO, Workheart Hospitals, is a seasoned leader with expertise in microbiology, hospital administration, and finance, a principal assessor for NABH. He has contributed extensively to quality management systems in Indian hospitals, spearheading NABH and JCI accreditation initiatives. The third panelist with us, Dr. Ilan Kumaran Kalyamurthy, Chief Executive Officer, Senior Consultant, Liver Anesthetist and Intensivist, Rela Hospital, Chennai, is a seasoned medical professional with over 20 years of experience. He obtained prestigious FRCA from Royal College of Anaesthetists, London, during his 5 years in UK. He focuses on enhancing operations, quality, and institutional growth. We welcome you, sir. Ms. Meeta Patel, Director, Medigens, is a seasoned expert in healthcare planning and design with over 24 years of experience, a certified NABH assessor, Quality and Accreditation Institute assessor for WHO patient standards and ART standards, and a certified internal auditor for JCI. We welcome you, Ms. Meeta. We have with us Dr. Palan Kundakam he's the Managing Director and Chairman of Shija Hospitals and Research Institute. He's accomplished plastic and aesthetic surgeon, and he has been a pivotal in establishing Shija Hospitals as a leading healthcare provider in Northeast India, including the region's first private medical college. Under his leadership, Shija Hospital entered NABH and NABL accreditations, and he has performed groundbreaking surgeries, including Guinness World Record excision of largest neck tumor and replantation of amputated hands. We welcome you, sir. We have with us the panelists, Dr. Suma Nair, Professor and Dean, School of Public Health, D.Y. Patil University. Ma'am has over 30 years of experience as a community physician, academician, researcher, and administrator. Dr. Nair's research focuses on public health nutrition, cancer screening, and communicable diseases, enhancing community engagement and fostering interdisciplinary interactions. We welcome you, ma'am. So without wasting much time, I would like to request our chair, Dr. Amarjeet Singh, to kindly open the panel with his remarks.
Thank you, Medha. This is something very, very close to my heart. I worked now about 15 years in the health sector, and I think public-private partnership is the way forward, especially for countries like India and many other countries in the world. I am very grateful to Medha for introducing this distinguished panel. I'm sure they have some wonderful things to share with you. I have 2-3 things to share before I let these distinguished panel loose on you. The first thing is, I think the name itself, Dakshin, is a wonderful name. What we heard just now, Dakshin in India is the most prosperous, most progressive, and highly advanced part of India. So Dakshin bodes well for this initiative as well. I have no doubt about it. The second part is there is a tradition, has to be a tradition of learning. And that comes through humility. It's only once you show respect to what others have achieved, others around this panel from various countries. I see so many participants from Seychelles, Senegal, Lesotho, and many other countries. You have to have that humility to learn from them. There's a wonderful incident in our folklore, in our classics, Ramayana, where we celebrate the victory of good over evil. After the victory, the person who represents good, Lord Rama, sends his younger brother, Lakshman, and says, go and learn something from Ravana, who's the evil, who's been conquered. Look at the humility. He's just conquered him. He represented all the evil. Yet he sends his younger brother, go and learn something from him. And not only this, Lakshman is an arrogant fellow. He goes there and stands very arrogantly, and obviously the learned Ravan doesn't say anything. So he comes back, and his elder brother Ram says, what did he say? He said, he didn't say anything. So Ram says, young man, where were you standing? He said, by his head. He says, you fool, go and stand by his feet. Then he'll tell you what he has to tell. The story just highlights what, if you want to learn something from another person, you have to have that humility. The third point which I wanted to make was, look at around you, look at the milieu around you, look at the ambience around you. We had a very serious COVID situation, like most of the world. And who do we turn to? 2,000 million doses of vaccine. 2,000 million doses of vaccine were given in this country, and the vaccine was produced by a private sector company. So there is a very healthy relationship already in the country where the private sector and government sector work very closely for the common good, for the common public good, okay? Look at the indicators. Look at the distribution of manpower. The experts who are providing care. 80% of your doctors are in the private sector. We were working on maternal mortality reduction in Gujarat. We found out of the 300 vacancies, there were only 9 people in place. Nobody wanted to go to the remote rural areas. No wonder the MMR was so high. Yet, there were 2,000 gynecologists and obstetricians in the private sector whom we could very, very easily associate with the program and reduce the maternal mortality of the state. So look at the balance, 2,000 doctors outside available to help you if you provide a good package, if you provide a good support system, and there are very few in the government. The same for nurses, same for paramedicals, and same for other staff. So my simple take is, you cannot meet 100% of the problems of a country like India when 80% of the resources are outside. I just want you to remember this point. 80% of the resources are outside the system. You cannot hope to just meet the 100% needs of the health sector of the country. You have to find a way of associating those 80% people who are outside the sector, who are products of your public system. You have to find a way of associating them, okay? Just one last example, and then I'll invite the panelists. Way back in '92, I was doing the blindness control program in the Government of India. We got the World Bank funding for that, okay? We were just doing 2 million cataract surgeries in the country as a whole, where India had the largest load of blindness in the world. And in '92, '93, we got World Bank funding for involving the private sector, the Rotary clubs, the Sight First, other NGOs in the program. Lo and behold, in 4 years, the number of cataract surgeries, just by '96, we started in '92, '93, increased to 8 to 10 million. In just a period of 4 years, just by having a proper involvement of the private ophthalmologists in the system. So I think you have to look at these issues, country-specific issues in your own countries, but I think you have to find a way of involving the private sector. And there are a number of such stories in India, which as part of Dakshin, one will be, the sector people around here would be very, very happy to share with you and take you through. Wonderful, welcome to this state again. And I now request Medha to invite the participants for their talks.
I now request Dr. Pankaj Bhardwaj for his remarks.
Yeah, thank you so much, Medha, and thanks again. And it was really wonderful to share this with my fellow chairperson, Dr. Singh. I was fortunate enough to work under his leadership when I was actually a resident in 2005 in GMC, Surat. And as he was mentioning about the initiative of engaging private sector in this scheme, I still remember those public health lessons of Chiranjeevi Yojana. So thanks, and it was really a wonderful opportunity today to get an opportunity to share this stage with you. So ladies and gentlemen, we are going to start this session because we are having very less time with us, unfortunately being the last in the queue. So today's session will totally be focused on role of private sector in strengthening the health diplomacy in India, and that's very important, which we need to understand, that here we are not just talking that how this private sector can strengthen the public health system of this country, but we'll take some of the insights of our experts who are sitting on this dais to know about how this private sector can help us in health diplomacy efforts of the country itself. So we will be talking about the current role of private sector in enhancing the quality of care. We will also be talking about the current challenges which they are facing, because that's always important to hear from the horse's mouth itself. What are the possible solutions which they offer and the way forward? So with this, I hand it over to both the discussants, Dr. Lalu Joseph and to Dr. Medha Wadhwa, to take it forward.
Thank you. Thank you so much. This is going to be a very interesting session, I'm sure. This is going to be the role of the private sector in strengthening the health diplomacy of India. Lots have been said, and I think we have very good panelists here who are going to be discussing about the role of the private sector. So let me straight away begin with the questions. If we have time, we'll go to round two. Otherwise, we'll just limit ourselves with one question per panelist. So we'll start with Dr. Parth Desai, who's the COO of the KD Hospitals, your neighborhood hospital here. Parth, how would you define the role of private healthcare sector in advancing India's health diplomacy efforts? A very broad question.
Thank you, Dr. Lalu, for the question. So, it's very well highlighted by Sir as well, the role of private sector involvement in all the initiatives of the government to be successful. The role of private sector is of utmost importance. When we talk about GHD, that is Global Health Diplomacy, and it's India's role, and again involvement of private sector, I see this as a multifold involvement of the private sector in health diplomacy. First is our healthcare setups and the wellness centers that we have across the country. So it is slated that our medical value travel will surpass $13 billion by 2026, while our wellness is also poised very nicely in the global format for the preventive aspects and the wellness aspects. So having involvement of private sector and then having our own presence in countries across outside India will make a lot of sense for people actually to be visible that India is a place where healthcare is kind of a most advanced along with wellness centers as well. So collaboration of wellness as well as hospitals becomes of an utmost importance, where again private sector has a huge role to play in. Second is pharmaceuticals in our country. So we all know that we are the pharmacy of the world, and we produce about 20% of the world generics, while almost 60% of the vaccines of the world is being produced at our place. So even in times of pandemic, that is COVID-19, when there was this vaccine production and all the debates around equity of vaccine across the globe, India was one who stood up that, okay, we are in a position to supply to our friends, our partner countries, that is in SAARC nations, ASEAN, and all the collaborations that we have actually formed, the Quad collaborations and all those collaborations. How do we work with all those collaborations by exchanging pharma things, exchanging consumable things, exchanging ideas of managing the pandemic, and in true sense, we lived up to the idea of Vasudhaiva Kutumbakam, that the entire world is our family and not just our country. So in that also, private pharma companies had a huge role to play along with the government thing in channelizing the materials across the globe. Third thing, which again is of utmost importance, is the role of private sector in handling disasters in the country obviously, but outside the country as well. One of the prime examples we saw was in Nepal earthquake in 2015, where Indian Medical Association and many other bodies of doctors and healthcare stood up along with government and had all the efforts in those countries to save the people there, to rehabilitate the people there. And it was a wonderful example that how our own national disaster response teams and national disaster management took up along with the private in managing disaster in another country as well. The same thing we saw in Turkey as well in 2023, that Indian doctors and government was praised quite a lot in actually managing disaster outside our shores as well. So broadly, if we see that hospitals, wellness centers, pharmaceuticals, and our own response to disasters, our involvement in WHO, UNICEF, UN, chief scientists like Dr. Soumya Swaminathan have been very influential in seeking into it that India has a prowess and India has a strategic vision in dealing with global health problems, and definitely involvement of private sector in all these sectors becomes of an utmost importance to all. Yeah.
Yeah, thank you, Dr. Parth. That was a very broad answer, and I think we'll go a little into a micro level, probably to Dr. Ilan Kumaran. So, sir, you are from the Rela Institute and Medical Care Center, and you have a lot of medical value tourists traveling and coming to your hospital. In what ways do you think has the private sector contributed to India's global health footprint, particularly through innovation, service delivery, and international collaborations?
Thank you so much, Lallu. Very nice auditorium. Good afternoon, all of you. It's one of the best auditorium I have visited. Open air, no electricity, nothing. It's very nice, actually. I'm sure all of you agree with me. Anyway, I joined medical school in 1990s. In the last 30 years, I personally have witnessed a huge growth in Indian healthcare. I want to share some numbers before going on to what actually we are doing in Global South. If you look at healthcare market in 1990s, it was just a $16 billion value. But if you look at now, in the last 30 years, the value has gone to $370 billion. It's going to double in the next 5 to 7 years. That's the growth we are sitting right now. Again, if you look at the private sector, most of the expenditure, 3/4 of this expenditure happens in the private sector. Of course, government does a lot of good work in terms of primary and secondary care, some areas in the tertiary care, mainly focusing on communicable diseases, focusing on maternal children and all this stuff. But if you look at high quality clinical care, it's being done by the private sector. Again, 30 years back, many of the private sector hospitals were situated mainly in the cities. But now you can see it's there everywhere. So we need to find out what we are doing to improve health diplomacy in Global South through private sector. I come from a place called the Rela Institute, and we are one of the leaders in liver transplantation. Maybe I can briefly share my experience so that we can also see how private healthcare sector is contributing to diplomacy in these areas. First of all, what is required for us and countries outside? If you look at countries outside, patients are looking for high quality clinical care at affordable cost, point number one. If you look at the government and professionals, they're all looking for developing self-sustainable programs within their own country. They don't want to send the patients outside. At the same time, patients are wanting to get low-cost, high-quality healthcare. That's a vision most of the countries will do. Like what we do in our country, Make in India, most of the countries will do it within the country. That's a concept they're all having. So this is the advantage for us, how we can help. If you look 15 years back, 20 years back, like people like us, when you want to get high quality training, we have to go abroad to get trained. I spent 5 years, and many of the doctors, nurses, paramedics spend a lot of time abroad to get trained. The situation has completely changed now in the last 20 years. We don't need to go to get trained abroad at all. In fact, we are getting a lot of foreign trainees, not only from the developing countries, even from developed countries, coming to many centers in India. Of course, not only private sector, even the government sector. If you take orthopedics, cardiac, transplantation, any specialties you take, we have significant numbers of foreign medical graduates getting trained here for a short term and then wanting to go abroad. I think this is the big thing. What we can help them abroad is knowledge sharing. That's we have been already doing it. In the future, we can actually expand more. Again, 15, 20 years back, affordable Indians have to go abroad for high-end treatment. Even liver transplantation from my field, nothing was happening 15, 16 years ago. Now, we are getting almost patients from 50 countries coming to our country to get treated, especially in liver transplantation, because of the high quality care. Second one is affordability. If you look at the cost of transplant surgeries, in US it would cost $300,000. In India, it's 1/10, 90% cheaper in our country. If you look at the outcome is almost similar. Since morning, we have been talking a lot about the pharma sector, medical devices sector, vaccine sector. I don't want to touch upon that topic because I want to focus more on hospital sector. Again, if you look at the GDP, healthcare sector contributes 5.5%. Again, most of the $374 billion contribution from healthcare comes from hospital sector. Rest of the things comes from vaccine and medical devices. So there is a huge opportunity for our country in terms of medical value travel, but it should be done because the challenges are huge. Thailand and Turkey are offering better experience for the patients. I wouldn't say they're offering better care or quality, they're offering better experience. Ease of doing a business is much, much good in those countries. I'm sure if we can focus on those areas, our medical value, travel value will go up significantly. He mentioned about $12, $13 billion now. That will double very easily in the next few years' time, but we need to focus more on it. That's my one point. And then it's really important to help people abroad, to train them, try to help them establish all the treatment available locally. That's what they have to do in the next 10 years. I think we can be part of it. This can be part of it. I don't know, purposefully being muted or... Thank you so much. I can come back actually. I want to let others speak.
Oh, thank you very much, Dr. Ilan. That was very enlightening, and we all do understand. My sister, I remember we had to take her 25 years back to US to get treated. And today the same condition, probably in my own hospital, we'll be able to treat. Such is the situation. And of course, as you said, the challenges are many, and with talks like this, we'll be able to sort out most of the challenges that we are facing. Let's move on to Dr. Falin. Dr. Falin is the chairman and managing director of the Shija Hospitals, and he has the medical college set up as well there. So what lessons can be drawn from successful private sector health diplomacy initiatives in India to strengthen its global healthcare leadership? What are your thoughts, sir?
Thank you, ma'am. We have seen in the last few years, especially following the corona and Ukraine-Russia war, most of the medical tourists are rushing to India. India is emerging as one of the leading healthcare destination in the world. India now ranks 10th out of 46 healthcare destinations in the world. In 2023, India treated 6.1 million, and 2024 it is increased to 7.3. And Bangladesh alone, 2.5 million patients were coming to India, but because of the unfortunate situation, now it is standstill. And India has surpassed, because Bangkok was the leading brand in East Asia. Now India has already surpassed. India has increased the JCI hospital to 55, and many NABAs and NABL certification, and less waiting time, and our culture, and consumable, and drugs. Another area here we would like to learn and also give a lot of input is our wellness. India cannot give that much importance as of now. India's contribution to wellness is only 0.3%, and North America is the wellness capital of the world. Asia Pacific is fastest growing. What I am telling is wellness tourism is, the market size is more than the medical tourism. This is one area, this is our strength also because of Ayush. Not only the Ayush, we have menopausal treat, corporate wellness, even hyperbaric oxygen therapy is also included in the wellness, and mental health. World Health Organization has already warned India that 63% of our deaths are due to non-communicable disease, NCD, and we need to change our lifestyle. At the same time, Massachusetts and Henry Wayne's Hospital already proved that meditation and yoga alone can reduce the healthcare expenditure by 43%. Meditation is now proved to be effective or changing even at the cellular level. 15 days meditation increase the length of the telomere, which is responsible for the longevity and immunity. And so also the stress, amygdala, because this functional MRI has already proved that those who are having this deep meditation for longer time, they have smaller amygdala. That is, the stress level is increased. This is apart from the situation, it is scientifically proved, all these things. And also we are biochemistry, our body is biochemistry. We are producing more than 1,000 biochemistry, this chemicals or pharmaceutical industry, and due to which we are changing our at the cellular level. Another area is this climate change. It is affecting this also. We are gearing up. India is not behind. Because of the climate change, there will be displacement because of the increased level of the sea level, and there will be migration, there will be food scarcity because of flood and drought, and there will be starvation, there will be malnutrition. Is going to affect the children, extremes of age, and heat stroke, waterborne disease, and mental health, so many other things. These are areas where India has to prepare. So for all these things, India needs massive infrastructure and ISR development. And this is this will be possible only with the help of private-public partnership. Otherwise, this is a huge challenge, not only coping with the medical tourists from abroad. We need to have our own we need to solve our own problem because of the lifestyle. And we need to have a concrete medical tourism policy or medical tourism board, just like the Thailand. Thailand has got a proper medical board. And another thing is we need to tackle or suppress or prevent this superbug, because this is going to damage our reputation, and the medical tourism may be drastically decreased because of this. So this requires a stringent policy so that the antibiotics are judiciously used, especially in the periphery. So many, because of the incentive and so many other, I think they are, everybody knows. So these are the areas we need to tackle. Otherwise, India can lead with the current opportunities we have and our this cultural heritage and Ayush, because India in fact this meditation and other programs are originated from India, but we are learning from we are relearning from other countries, developed countries, because they have already done the research. We need to research on Ayush also. Thank you very much.
Thank you, sir. Rightly said, AMR is a major challenge, and I'm glad that Government of India is taking several steps with private-public partnership and including educating the patients. Extremely important to handle that immediately as a major challenge. Now let's move on to Dr. Parag Randani. Dr. Parag, how has the private sector shaped India's global health influence? Also, I would like to club it with another question, where how do you think that the private sector can support capacity building in other countries through training, skill development, and knowledge sharing? Your thoughts, please.
So, I think COVID kind of put us there on the pedestal, but what the developed countries, quote unquote, we did in over maybe 60, 70 years in terms of managing healthcare quality, institutionalizing patient safety, ensuring more sort of capacity building within the country at the grassroots level. I think we've done it in about 20 years. Our national accreditation is a classic example. Our technical teaching institutions are some of the finest. Maybe the spit and polish is not as much as maybe a foreign institution, but the learnings that, the teachings that happen there are the best, which is no secret that today we have a GAPIO, which is actually, we have tons of physicians and surgeons in the developing countries which are from India. So I think we've kind of shaped things. A majority of research on clinical trials and research today happens in India, be it because of the cost, be it because of the population, but I think it's also because of the quality of the clinicians that we have who are able to drive this research. And I think what is another very, very important thing is then the level of new molecules that are coming out today from India, whether it's anti-infectives, whether it's in the anti-diabetic space and all of that, a lot of that is also coming today from India. Plus, being a low-cost, high-quality kind of center, that paradigm has now changed to being a high-quality, medium-cost kind of a center for care. Coming to capacity building, we've been building capacity for years. One needs only to walk into any ward in any American or British or German hospital, and somewhere you will hear some Malayalam words or some Hindi words being spoken, because that's a testament to the fact that a lot of our nurses are export quality, quote unquote, and it sounds rude, but it's a fact. So capacity building as a nation, we've been given, we are practically the medical cradle of the world in terms of doctors and nurses. It's no secret. Time we kind of retain some of them, but that's a topic for another day. What is important is, over the last 2 decades, after the advent of, globalization, as we speak, more of the, like being a more global member of the fraternity, of the health fraternity, we've actually been doing surgeries abroad. All our hospital groups, any of the hospital groups, all of them had been doing surgeries abroad. Gone are the days when we would run to a developed country, people are running to us. Medical value tourism is catching on. I think one of the biggest things is that we are now teaching some of the countries in the global south basics on stuff like basic life support training. We are building capacity in those countries by having training of trainers. We have people who come over here, get trained and go back, and there are NIDUSes of excellence, centers of excellence being developed there. Also, capacity building needs to be enhanced by way of having better regulation surrounding the training programs themselves. Right now, there's a little bit of a gray area in terms of how people can come over, get trained here, recognition across the world. I think, if anything, Dakshin can also look at, it's in cross-border credentials being accepted. Within India, we have the Healthcare Skill Sector Council, which acknowledges that a radiology technician trained, let's say, in Dr. Rela Hospital would be recognized at Wockhardt Hospital and vice versa. So these are things that we need to recognize. Cross-border parity of the trainings that we give is something that we need to do. Of course, better and better, more and more people coming for physical training to our country, our trainers going across to other countries. I think another classic example, which the government of India has been successful, is in this whole concept of Asha Tai, Asha Didi. I think we need to take these grassroots level initiatives so that we are able to render primary care to begin with, move on to secondary care, and then of course our tertiary care institutions are ever so ready to add medical value travel to the armamentarium. I think that kind of sums it up.
Yeah, thank you for that. Of course, our training is most wanted, and we are seeing that too at CAHU, at the Consortium of Accredited Healthcare Organizations. We run almost 58 training programs, and what started for India is today catering to 58 countries across the globe. Many countries join us through our online training program, and we are today running a conference in Sri Lanka called the LankaCon. So that's the demand for Indian healthcare. And let's move on to Meeta Patel. And Meeta, as a director of Medigens and as an independent consultant, what do you think should be the strategies that private healthcare sector can adopt to foster collaboration with international organizations and governments and effectively address the global health challenge? Your thoughts?
Thank you so much, ma'am. It's a privilege to be a part of this esteemed panel. My views, most of the things have been spoken about what a hospital can do and what medical tourism can bring in. When we talk about dialogue on health diplomacy, it has to be both ways, right? We cannot just be a part of India and bring in people. We also have to move out sometimes. So we think in two aspects in terms of developing a good infrastructure in our neighboring countries, in the countries like low-income, middle-cost countries. So these people need a good infrastructure to start with in terms of developing a good healthcare structure. Now, having said that, they already have people there, but they need some good guidance. So India has been evolving as a guru, medical, in the healthcare field. So we need to identify those aspects in those countries, and we can help them foster those relationships with them. Secondly, here, when we attract medical tourism, we can have infrastructure-wise, we currently, all the major private hospitals, corporate hospitals, they try and identify, separate floors for them so that they feel comfortable. When the international patients come, they have different needs that we cater. So that we are already doing. So we need to foster that relationship again with them. In terms of capacity building, again, a lot has been spoken about, but then our doctors, there are a lot of other hospitals in the country currently, they are sending their doctors and nurses to let's say Mayo Clinic and Cleveland's and to learn and train. So they are already partnering with us. We are partnering with them in terms of giving them the best quality of medical solutions and the clinical outcomes. So that is one which we are doing, and we should strengthen that opportunity. We should highlight our own the facilities and structure in the global forums. In many of the, there are a lot of, CAHO is doing a lot in terms of international benchmarking. So ISQA, we represent ISQA, we represent mostly all the Arab Health also, Lalu ma'am is being a speaker. So all these things we are now gradually developing in terms of fostering relationship with the international people. COVID has brought the entire world together so close that now things are quite approachable. So we should definitely, strengthen upon that. We can have the collaborations and research between different first world countries also. They can help us in getting good, let's say, the tools of implementation can be a part. Secondly, we are already doing our bit in terms of gathering the data. So the data collection that we have just started recently, it wasn't there in past, but I'm sure Wockhardt and other hospitals like such big chains are taking a great initiative in terms of collecting such kind of clinical outcomes and clinical data that will help in identifying our own strata and taking on from there. So that is one part. And we can have, as a consultant, we are not only into, so the accreditations and all, they have brought together a lot of things in terms of building good infrastructure, in terms of building good quality outcomes, clinical audits, and a lot more. But that has to be a part of the other countries as well. So like NABH and JCI are doing their bit. So the awareness in terms of accrediting a healthcare body is very important. As a consultant, we can identify those things and we can tell them that as well. And India already has a good, internationally there is a lot of demand of doctors and clinicians and nurses. So why not encourage that as well? So this is my view on the parts. Thank you so much, ma'am.
Thank you so much. I think data is the key. What gets measured gets measured gets monitored. We really need to have that data in place. Now, currently, I think we have problems with data collection. Though there are hospitals that are accredited, we need to really showcase India with data. Now, with the volumes that we have, we tend to hide behind the volumes to say that, it's all scattered everywhere. I think effort should be taken to get the data together so that we can project with the right numbers to the globe. Over to Dr. Suma Nair, the Dean and Professor at DY Patil. Madam, what role do you think telemedicine and digital health technologies can play in advancing India's health diplomacy goals, particularly in resource-limited setting?
Thank you, Dr. Lalu. So being the last speaker is rather a challenge since most of it is already covered. And I think I'm the odd man out here from the academia and public health. But nevertheless, yeah. So as cliched as it may sound, we've already heard how the pandemic gave an opportunity to leapfrog into the realm of health technology. And we've already seen how India, brought about so many innovations, may it be the eSanjeevani app to bring about telemedicine, increasing access to the, the vulnerable, underserved population. The CoWIN app, which essentially I feel was the backbone of our success in bringing about this mass vaccination. And likewise, now you have a lot more, the Practo, a lot of those wherein you can actually make appointments, order medicines. So there's a huge amount of, technology which is being brought forth. And yes, it is, could be from the government sector, but also from the private sector. So being part of a private university, especially a multidisciplinary private university, gives us a unique advantage to collaborate with various disciplines and bring in the expertise of these various disciplines to, think about some newer innovations in the digital health technology. So I'll give you an example of what we have done. We collaborated with the Technology Institute, with the medical school, and of course with a global north and a global south country, from investigators from across. And we brought about a technological solution for tracking sexual and reproductive health. Now, there's a huge public health problem, particularly in the vulnerable, difficult to access group. So this was something which was brought about. Now this, what did it do? One, it customized the requirement for the country. So country specific, which is required for that particular population, and also for the other countries. So it was customized, and that was with a lot of deliberations, capacity building. Now this capacity building was not just for the investigators, it was also for the grassroots level workers, the medical laboratory technologists, the grassroots level workers who are also putting across this initiative into the field. So all of this was made possible because of this collaboration. And of course, in collaboration with the government, otherwise nothing is possible. So this kind of public-private partnership and also collaborating with other, global north and south, because you can have, this exchange of ideas, knowledge sharing is required for us to bring out the best. And this essentially is what is going to make it better in the days to come. And I believe private universities have a huge advantage in this, particularly those who are multidisciplinary, have the reach, and can bring about this revolution. But also, we should also keep in mind that when we do this, it's important to make sure this is available to the last person. So just to, twist the words of the WHO chief, no person is healthy unless everyone is healthy. So we need to think about it. So all of these technologies will have relevance, only we also think about the last person out there. And this is something which is possible with the private-public partnership and, of course, cutting across. And on the side, I'm not sure that Dakshin is a great initiative. And I'm not sure how many private universities and are aware of this. It would be nice if all these initiatives are put across, so we also come to know, so that there is more sharing of knowledge, thought process. So in effect, we're going to bring out something which is going to be useful, not for our country, but across the world. And like we already saw, this kind of a diplomacy, health diplomacy, clearly translates into political and economic diplomacy, and that's the way to go. Thank you.
Well said, madam. And I think it's that last man on the line, and how do we reach that person? The way UPI has reached every shopkeeper, and that's amazing. And today we cannot say that, people who are living on the streets do not actually know technology. They know better technology than all of us. And it's interesting to note that there are several technology tools available in healthcare today. The contactless remote monitoring that has literally revolutionized the way we monitor the patient, and we don't need that many nurses to be going and checking every 4 hours. Amazing things are coming in through technology, and thank you so much. I hand over to Dr. Mehta.
So our panelists discussed very well the role of capacity building, the medical value tourism, the role of data. Majorly the data in terms of real world evidence needs to be picked up, especially in countries like India. We can take the lead, and we can even take the lead for the various different countries down south, and we can help them build the database and help them in creating a repository for the real world evidence. So that's one area which can easily be picked up by a country like India. We are taking a lead in terms of data, so that should be quickest thing to do for us as well. We need to break those silos as well, and to add on to that, I would like to ask a question, and because of paucity of time, I would request Dr. Fallon and Dr. Lan to quickly summarize if they can share some example, because their organizations being at a strategic advantage position where cross-border if they can share those cross-border examples which have helped in transforming the lives of people as well. So if they can quickly summarize it up, it would be great for our audience as well.
Thank you. India is acting to connect with the Southeast Asian countries. and Manipur is border with Myanmar. And CSER is an organization starting from a monopractice to a super specialty hospital, then the first homegrown private medical college in entire northern India. We have most of the facilities for which people are traveling. And I would like to say about CSER Mission Myanmar. This is very close to my heart. And on the request or invitation from Indian Consul General, Union of Myanmar in 2013 and 14, when Myanmar was a democratic country, we were invited for a surgical workshop, and we have gone there 3 times. Keyhole surgery, cleft lip and palate. I myself is a plastic surgeon and partner smile trained surgeon also, and cataract surgery. Huge number. They have got a huge number of patients because their facilities are very, very lacking. And we have done 339 surgeries altogether, and we have trained 2 nurses, 6 nurses and 2 surgeons also. And we had one medical camp in Calais. We have done the surgery camp in Mongya General Hospital. This is the capital of Sagaing, which is neighboring with the northern India. And after that, they come to know that there is a place called Manipur where they can go. Otherwise, they were going to Bangkok and Singapore, where the cost of treatment is 10 times, 7 to 10 times. And we have, there was a pouring of medical tourists. We have treated more than 5,000 patients, including kidney transplant, brain surgery, cardiac surgery, joint replacement, and mostly stone diseases. And even they have proposed a hospital in their country also. And we have proposed training of doctors. We have already gone there for a workshop also, keyhole surgery workshop. And we have proposed for training of nurses, doctors, technicians, and even the Minister of External Affairs about to allot us a plot in the ICP, Integrated Check Post, land for construction of a hospital. That was the situation. But somehow it did not happen because of the current situation following Corona in Manipur, as you know, everybody knows. It is standstill, and the situation in Myanmar is not within my control. So we only hope that it will be developed. So when we stopped acting east, we started acting west. We wanted to address Bangladesh because I already mentioned that 2.5 medical tourists are coming to India. We want to set up a hospital there in Agartala, where they could come. Just neighboring, hardly 5-6 kilometers. And Tripura is a border in 3 sides by Bangladesh. Again, Bangladesh is having a problem. Somehow we are allotted land for construction of the structure from government of Tripura. Another thing is we have already trained nurses for language and culture for Japan. We have already sent 8 nurses. Manipur is producing the highest number of nurses in the country, it seems, next to Kerala, but recently probably Manipur has surpassed. To summarize, what we have right now in India is not the reality. The reality is what we visualize. Whatever we want, we have to visualize and create it. In another 10 years, India will become will be included in the top 3. If we continue to work and create ideas and implement, sure, in another 10 years, the growth rate is very fast, and we will be one of the top 3 in another 10 years. Thank you very much.
Thank you, sir. Very nice initiative, and congratulations for all your activities. Regarding our experience, So if you are able to provide a high quality clinical care, and if you are able to adapt innovation and technology, patients will come from everywhere, anywhere. I think that's the bottom line actually. 15 years ago, we have started the liver transplant center in Chennai. Our main goal was to provide service to the local patients. Within few years, we are able to stop patients moving abroad for any liver transplant surgeries or any hepatobiliary surgeries. And we are one of the examples of many centers, so you can use this as one of the models. Maybe if you look at today, I don't think any Indian will be going abroad for any liver surgeries. Most of the surgeries are happening in our country itself. So what we have done in the last 15 years, we haven't stopped ourselves locally to serve only the patients coming to us. We wanted to expand our skill set, share our knowledge to many people in India and abroad. In the last 15 years, we have helped establishing 25 centers to start their liver transplant program. 18 of them are from India, 7 of them are from abroad. If you take Saudi Arabia, Islamabad, Pakistan, if you take Sudan, Oman, Sri Lanka, UAE, we are part of their first liver transplant program in the last 10 to 12 years' time. And I have been part of, I'm an anesthetiologist, so I have been part of the first transplant surgery in most of the countries, even including Islamabad. I have been to Islamabad. Even Sudan, we have helped them to do 2 transplant surgeries on their own in Khartoum. Because of the local issues, we are not able to help them out. So how it evolves is, so the local team from those countries will approach us saying that we wanted to start a self-sustainable liver transplant program. We will choose them. We will put them in a structured program, saying that you have to spend at least a couple of years or 2-3 years in our country. Not only the doctors, it's really important to develop the whole team, paramedics, nurses, anesthetists, intensivists. The whole team will be trained in our center. Based on their experience, we'll put them in a program. Mostly the surgeons will need 2-3 years of training. And then what we would say is, we will start clinics in their local center. This will take 2-3 years for us to develop the relationship. And then we start supporting them start their own program in their countries. So another example is the country of Oman. We have got direct MOU with the government of Oman. So whenever there is a patient in their country have any liver issue, they will come to us. In the meantime, within 7-8 years of time, because the government wanted, the local professional wanted the program to be self-sustainable in Muscat itself, we have trained the local team. First 20 transplants we went there, supported their program, hand-holded them. Now we are not even going there. Most of the straightforward cases were done by the local team itself. Any complex cases, they are sending it to us. So this is the way we can help countries, we can help patients getting high quality care at affordable cost in our country initial periods. And if the country and healthcare professionals wanted their program, put them in a structured program, train them, support them, help them to do local procedures. So at the end of the day, they want to do things on their own. I think this is how we can develop a health diplomacy from the private sector. This can be a good model many centers can adapt. Thank you so much.
Thank you, sir. And I think I would take the quote from Dr. Falin that in India we need to visualize and we can bring that to reality. And from taking that quote forward, I would like to ask Dr. Parth and Dr. Parag one innovative model that they would like to suggest for bringing this thing. We heard the examples that both the doctors, Dr. Falin and Dr. Ilan shared, and how their organizations in solos and silos, and they are contributing to the health diplomacy of India as well. So we would like to take their suggestions and their expertise also on board with us.
So I think what we followed is we right now are in tie-up with 6 countries in Africa, wherein we are getting into the mode of each one, teach one, do one. So first, you see one, teach one, do one. So we are doing, for example, surgeries in those countries of a particular requirement which the local population has. Once that happens, we are calling them over here. The surgeons come over here to our hospitals. They actually see how our surgeons are doing. They do surgeries under the mentorship of our surgeons here. And once they've done a critical minimum of surgeries, then they are able to go back and again supervised by surgeons do about 10 surgeries there. So typical thing what I think everybody in healthcare knows is the mentorship model. We are able to do that. We are also doing the same thing with critical care nursing. So this is something, I'm not sure it's innovative. This is the way medicine has always been practiced. But this is something that we are actually using as a bridge to health diplomacy to be able to get everybody on a uniform platform in terms of the people on this planet. But
that is the basic. So maybe first we evaluate that what are the needs of other countries in terms of their healthcare needs, and obviously first thing which comes to our mind is training their human resources, which Dr. Parag sir wonderfully explained. If we talk about some another innovative models of engagement in health, then thing that comes to my mind is the usage of telemedicines, and now in our era we are leading the globe in the coming times for artificial intelligence as well in healthcare. So how we can use these technologies to engage people for their healthcare needs as well as to connect them for their training needs, will kind of become an innovative model whereby India will have its own prowess in the healthcare diplomacy. And when we further grow, the evolution of robotic surgeries, which we see with internet going more and more stronger, the days are not so far that installation of robot can be at one place while surgeons can be at another place. One of the example tried was in Ahmedabad for angioplasty. So if such kinds of models do evolve, then definitely our position globally can be more strengthened on.
Thank you, Dr. Parth and Dr. Parag. I think capacity building through digital health and AI can revolutionize the entire health system for the different countries in Global South as well. And that could set the stage for our health diplomacy initiatives, keeping in mind and taking the role of private sector forward as well. Keeping in mind the paucity of time, I would like to conclude our panel discussion and hand over the mic to our esteemed chairs for concluding the panel.
What a distinguished panel it has been. It's been humbling to listen to all these wonderful people. Look at the wonderful work which they highlighted. The work on disaster management, which Parth so eloquently highlighted. The work which is being done by a friend Ellen Kumaran in the Rela Hospital. 3,000 liver transplantations handled every year. It's an amazing work which this hospital is doing. That speaks volumes for the excellent work which this hospital has put in. The excellent work by Palin, Dr. Palin, in one of the most difficult areas in our country, in the Northeast, and yet looking to the needs of the neighboring countries like Burma and Bangladesh. Focus on preventive care, focus on the super drug. I think super bug, I think wonderful initiative which Dr. Palin is doing in a difficult area. I was very interested in hearing about the clinical trials which Bokard Hospitals is doing in Prague, which highlighted. I used to work with Havil Khurakiwala some time back, and excellent center of care they have set up. And the work on accreditation, I think that has really, really picked up. I remember Gujarat was one of the first where the laboratories in the medical colleges and district hospitals and PHCs and CHCs were accredited by the National Accreditation Board for Hospitals and National Accreditation Board for Laboratories. And the person who did that is now the National Quality Control Manager, Dr. Jayal Meena. He did that in Gujarat. And the work on measurement, what gets measured gets done. I think wonderful. And we had a wonderful person in Dr. Joseph. You must go and see, people who come from outside must go and see CMC, the work, the high quality work which that hospital does. I was there a few years back and I wanted to meet the students from the preventive and social medicine department, and they said they're not available. I said, why they aren't available in the class? They were all out there because they had to perform 25 deliveries in each of their years. Is it right? And that's probably the only hospital, only medical college, which makes it mandatory even for the PSM people to do those deliveries and turn out excellent PSM people. And of course, to my right, Pankaj, AIMS is our very, something very proud of in the public sector. He had the School of Public Health in Jodhpur. So I think there's a galaxy of people around here. But one advice which I want to give to, as a little person with a gray beard, to all of you, in whatever you have to give and offer, wonderful things you have to give and offer, please never be patronizing. It has to be a joint team making an effort to develop that particular care of health. The moment you turn patronizing or an elder brother, it puts off the other person. It puts off the other person totally. It's cut off from you. And that's the only piece of advice I have. I would like to place on record my sincere appreciation for this Institute of Public Health, Gandhinagar, MEDA, and the director, Deepak, for organizing this wonderful discussion. Thank you.
Thank you so much, sir. That was amazing, and really it was amazing to hear from all the experts. So in the role of chair, so what I'll do is that I'll try to summarize it as in the smallest possible way as it is possible for me. So when we started with Partha and the solutions, I'm just talking about, as I said, Dr. Singh said about where are we currently. But as we started in the beginning, we said that we will be talking about what are the solutions and what is a way forward. So the solutions which come out are, number one, which it started with the Partha when he said about that it's the time to look after this health and wellness centers, preventive and wellness centers, and these medical value travel, which is, I think, an important idea which came up from the discussion. When it comes to Dr. Ilan Kumaran and Dr. Parag, I think the very important part which Dr. Singh also said, but they have been doing is this hand-holding or establishing other centers, not just 2 centers. We should have more Dr. Ilan Kumaran and we should have more Dr. Parag and their hospitals. They may be the hub and spokes in other countries, in India as well as in the South or the global South. They talked about this affordable high quality care and knowledge sharing, but at the same time I'll hire some of the dictum or some of the words or mantra which Parag said, and that was, now it's the time to change from low cost, high quality to high quality and then medium cost, and thank you. It's such a wonderful word which I'm taking home to my hospital also. There was one more thing which came in the discussion from Parag as well as from Ilan Kumaran, and that is that it's the high time when we say that hospitals like AIMS or PGI or JIPMER or CMC, when they have their academic programs, they do have professors, but we have professors in these private hospitals also. Let us take them on board as professor of practice, and I think it's the high time when the private hospitals, they should also act as professor of practice and should have these good clinical practices and teaching and showing by doing by showing. This a kind of a thing which we always say that our trainee doctors should see them. When we go to Meeta Patel, she also talked about this two-way exchange program, and I think the way she said that it's the high time when the government hospitals, people like Dr. Singh, who is sitting with me, a senior most bureaucrat, that they should give enough visibility at government platforms where we should actually give them a chance to get their visibility across country. And when we are talking outside country, it should be our responsibility being from public sector hospitals. Then Suma also talked about that digitalization and telemedicine and the time for this public-private partnership. I think that's a very important thing, though we have been speaking about it for years together, but it's the time, high time to talk about it in a more meaningful way. And last but not the least, I think with all these solutions, we will be able to ensure a kind of accessibility, affordability, and acceptability, because we know that in India or abroad, people have more acceptability of the private hospitals, but at the same time, it's the time when we all jointly work together for a good quality patient care. So thank you so much to all the panelists, to my fellow chairperson, Dr. Singh, and to the organizers for giving this opportunity. Thank you so much.
Thank you, sir. I would like to extend my heartfelt thanks to our esteemed panelists for their valuable contributions to today's discussion. We truly appreciate your time and thought leadership in enriching this important conversation. I would request our chair, Dr. Amarjeet Singh, to kindly felicitate our panelist, Dr. Parth Desai and Dr. Parag Rindani. I request Chairperson Dr. Amarjeet Singh to kindly felicitate our panelist, Dr. Kalyamurthy. I request our Chairperson, Dr. Pankaj Bhardwaj, to kindly felicitate Ms. Meeta Patel. I request Dr. Lalu Joseph to kindly felicitate Dr. Paleen. I request now Dr. Medha Wadhwa to kindly felicitate our panelist, Dr. Suma Nair. I invite our director, Dr. Deepak Saxena, to kindly felicitate Dr. Pankaj Bhardwaj. I invite Dr. Anish Sinha, Registrar IIPHG, to felicitate Dr. Amarjeet Singh. I request Dr. Apurva Kumar Pandya to felicitate Dr. Lalo Joseph. And I request Dr. Shabana Khan to kindly felicitate our discussant, Dr. Medha Wadhwa. I request panelists and chairs on the dais to come forward for a group photo. बोला तो था Thank you everyone for your time. Esteemed guests, distinguished panelists and participants, as we come close to this enriching event on navigating health system challenges, India's health diplomacy in the global south, I want to extend my heartfelt gratitude to each one of you for your active participation, insightful contributions, and unwavering commitment to the cause of global health. I request Srimati Kadri Biswas, IFS Director, PP&R MEA, Government of India, to come on the dais and have some closing remarks for the event. I request Srimati Kadri Biswas, Director PP&R MEA, Government of India, to kindly come here and have some remarks on the today's event.
Good evening, everybody. It's been a wonderful 2 days. And I would briefly like to explain what Policy Planning Division does. We are the outreach arm for the entire ministry when it comes to centers of expertise and policy bodies and think tanks and scholars and experts. So this is the first time we did something on health diplomacy, and if you look at the way international relations is evolving, you can see diplomacy expanding its borders into every given topic under the sun, whether it's space, climate, population, migration, whether it's Arctic diplomacies, health diplomacy. It was high time that we had a wonderful event like this. My congratulations to IIPH for hosting such a well-curated program where me and my colleague from the ministry, we're going back with lots of thoughts, lots of ideas, and we eagerly await your report for this event to share it within the ministry and outside so that the discussions over these 2 days are not lost and the ideas thrown up, the suggestions thrown up build into continuous efforts like these, because the conversation needs to continue. I'm quite sure that we've just touched the tip of the iceberg when it comes to the issues impinging on health diplomacy. And I wish you all the very best, and thank you again.
Thank you, ma'am, for your remarks. I request Dr. Anish Sinha to please come here for concluding remarks.
A very good evening, distinguished guests, esteemed delegates, excellencies, and officials. It is with great honor and privilege that I extend my heartfelt gratitude to all those who have made this dialogue on navigating health system challenges, India's health diplomacy in the global south, a remarkable success. First and foremost, I express our deepest appreciation to our chief guest, whose insightful words and inspiring presence have graced this event. Your guidance and encouragement will undoubtedly resonate as we continue our endeavors to advance health diplomacy in the global south. I extend my sincere thanks to the Ministry of External Affairs for providing us with this invaluable opportunity to convene such a significant and impactful dialogue. Their vision and support have laid the foundation for this initiative, enabling us to address critical health challenges and foster global collaborations. I am profoundly grateful to our partners, including MAHE, the Manipal Academy of Higher Education, and the Gates Foundation for their steadfast support and commitment to this event. Your contributions have been instrumental in enabling the meaningful discussions and collaborative efforts that we have witnessed over the past 2 days. We are also thankful to the government of Gujarat for their remarkable support in hosting us at the UN Mehta Institute of Cardiology and Research Center. Your collaboration has enriched our discussions and strengthened our shared vision for advancing health systems. Special thanks to the Department of Health and Family Welfare, Government of Gujarat for their continuous support and Deputy Medical College faculty for this event. We are extremely indebted to the Department of Tourism, Government of Gujarat for their support. A heartfelt thanks to the excellencies and officials who traveled to Gujarat for this event, as well as the officials from different states who took time to be part of this important dialogue. Your presence here underscores the collective commitment to health diplomacy and collaboration. I extend my deepest appreciation to our speakers who traveled from far and wide to be with us and shared their invaluable insights and expertise. Your contributions have eliminated critical pathways to addressing challenges and leveraging opportunities in health diplomacy. I take this opportunity to thank our visionary director, faculty members, and staff for their support. Finally, I express my sincere gratitude to the organizing teams, including our special students who made this possible, who worked tirelessly to ensure the seamless execution of this event. I would especially like to mention Dr. Medha Wadhwa, faculty at IIPHG, who was instrumental in planning and smooth accomplishment of this monumental event. As we conclude, let us carry forward the insights and collaborations forged here with the shared purpose of advancing health diplomacy for a healthier, more equitable world. I also stand here to express our sincere gratitude to Dr. Amarjit Singh sir, who has been instrumental in setting up this institute, and his contribution in health sector is immense, both at the national and at the state level. Thank you, sir. So thank you all and have a safe travel. Thank you. And I apologize if I have missed anything. Okay. So with this we end. We have tea, snacks at the food court. Thank you. किसका ग्रुप